स्किन टच जो फर्स्ट टाइम होता है, आज नहीं है, ये बहुत पहले से रही है, लेकिन थोड़ा सा हम लोग मॉडर्न युग की तरफ बढ़े जरूर है, लेकिन अपने जो हमारे संस्कार थे, जो कल्चर थे, जिसको बिडाप करते थे, किसी वजह से वो छूटे हैं। इसी कारण से मुझे लगता है कि हम लोगों को आज इस कॉन्फ्रेंस को बनाना पड़ रहा है, या इसको हम लोगों को अवेयर करना पड़ रहा है, जबकि ये तो जागरूकता सबके अंदर है। यदि आप याद करिए, हमारी नानी दादी सभी लोग थे, तो सबसे पहले कुछ लोगों के अंदर मिथ जरूर था, उस बिल को हटा देते थे, लेकिन आज की डेट में सबको पता लग चुका है कि नहीं, इसके लिए हमारी आशाएं, हमारे जो हेल्थ सिस्टम, हमारा जो पीएससी है, जो हमारे सीएससी है, जो हमारी आशाएं हैं, हमारी एएनएम है, हमारे सीएचओ हैं, वो गांव में प्रमोट करते हैं इस बात को कि बच्चे को पैदा होते ही सबसे पहले माँ का दूध दिया जाए। इसी वजह से आज जो टेक्निकल चीजें हैं, हमारे यहाँ पर स्पीकर्स हैं, कंसल्टेंट यहाँ पर आए हुए हैं डिफरेंट कॉलेज से, मैं उनसे अपेक्षा करूंगा कि इसकी जो सही फैक्ट क्या होगा, रीजन क्या होगा, हम कैसे इसको अच्छे ढंग से बच्चा जो है मदर का ब्रेस्ट फीड जो है कर सके, उसमें प्रॉब्लम क्या आती है उसको, ये हमारे जो स्पेशलिस्ट हैं, जो हमारे विशेषज्ञ यहाँ पर मौजूद हैं, वो इसको इलेबोरेट करेंगे अच्छे ढंग से। मैं इसी के साथ दोबारा पुनः एक बार आप सभी लोगों को, स्पेशल केयर कॉलेज को मैं अपनी शुभकामना प्रेषित करता हूँ कि आपने बहुत अच्छा प्रोग्राम रखा है, और इसे आपके बच्चे साथ साथ जो ऑनलाइन भी हैं, उनको भी एक अच्छा मैसेज आएगा, उनके दिमाग में होगा कि हमें कुछ नया करना है, कुछ नया सीखने को मिला है। और आपको पढ़ने की जरूरत नहीं है, आज आपके जो गेस्ट यहाँ पर आए हुए हैं, जो स्पीकर के रूप में आपको बताएंगे, आप किसी भी एग्जाम में, मैं बता दूं 10 साल बाद यदि आपको कोई अगर आर्टिकल लिखना पड़े, कोई पीपीटी बनानी पड़े, तो शायद आज आपके लेक्चर आज इस दिन को याद रखोगे। यदि आपने सीरियसली किया तो आपको जरूरत ही नहीं पड़ सकती, आप आगे बढ़ेंगे। इसी आशा, इसी कामना के साथ मैं पुनः एक बार आपको सभी लोगों को धन्यवाद।
Thank you so much, sir, for your gracious words. Sir, we are honored to have you here as a chief guest, as we all know that you are a very active personality in every healthcare society. Thank you so much, sir, for being here today with us. Along with this, I would like to invite care students for Vandana. Students, please come forward to the stage for your Vandana performance. Please everyone give them a round of applause and as you all know that we all are gathered here for an educational campus. So as you all know that शिक्षा सबसे शक्तिशाली हथियार होता है, कि शिक्षा सबसे शक्तिशाली हथियार होता है जिसका इस्तेमाल आप want you to know some and get knowledge from the conference. Thank you. Now it's time to move forward. We are officially ready to commence our awaited conference. Along with this, I would like to request all the dignitaries come forward to the stage to officially open our today's conference theme. Please dignitaries come forward to the stage to officially open our today's conference theme. I would like to request all the students, please welcome them with your gracious applause. Thank you, dignitaries. Thank you so much. As we now officially opened our theme for the conference, I would like to invite Mrs. Shubhangini Sharma, Additional Director as well as Associate Professor at Care College of Nursing, Haridwar. Before she begins, let's watch a short introductory clip about her. I would like to request our IT shell, please play the video.
It is our pleasure to introduce our first speaker, Mrs. Shubhangini Sharma, Associate Professor and Additional Director of Care College of Nursing, Haridwar, who has made significant contribution to the field of nursing profession. With a distinguished academic background, including a BSc and MSc from the esteemed Birla Institute of Medical Research and a PhD from Manvanchal University, Mrs. Sharma has established themselves as a leading expert in academic and management, and she is a leading personality of Care College of Nursing, Haridwar. She has 9 years of teaching experience She has also conducted various state and national level workshops, seminars and conferences. She is also a research guide for PB, SC and MSc students. She is currently working as an additional director and she is a whole soul personality of the Care College Nursing, Haridwar. Her impressive achievements include securing first position in both their BSc and MSc program. She has received the prestigious Shiksha Gaurav Samman Best Teacher Award by Dr. Ramesh Pokhriyal Nishank in 2023 and been honored with the Government Award by Baby Rani Maurya for her excellent professional conduct. Today, Mrs. Sharma will share her insight by introducing the theme of the grand event with their wealth of knowledge and experience. This is sure to be an enlightening and engaging session. Please join us welcoming Mrs. Shubhangini Sharma to the stage.
Thank you, Ms. Rashmi. So, let's make breastfeeding work and work. A very good morning to one and all present here, respected Director Ma'am, Director Sir, beloved resource person and all delegates. Today, I'm very honored to introduce the theme of this conference. So, if we talk about the theme of this conference, as you all know, the theme of this conference is Closing the Gap, Breastfeeding Support for All. As we know, every year we celebrate the Breastfeeding Week from 1st to 7th August, as well as this campaign is from 1st to 7th August. So next, the outlines what I covered in topic, that is theme introduction, about campaign, key message and purpose. So if we talk about the theme introduction, so that is World Breastfeeding is held in first week of August every year, supported by World Health Organization, UNICEF and many ministries of health and civil society partners. So as I mentioned earlier that breastfeeding week and this camp is always held in 1st to 7th of August. So next is why this theme has been chosen. This is very important. The campaign will take place from 1st to 7th August and the main aim of this, the aim is to raise the awareness of breastfeeding importance and its benefits. The campaign will also celebrate mothers and highlight how families, communities, societies and health workers can support them. Basically, this theme has been chosen because we have to make society breastfeeding friendly. Sometimes women didn't get support from the families, neighbors and communities. So we have to fill all these gaps. That's why this theme has been chosen. So next, of course, there are many mothers. Busy demands are there. Sometimes women who may want to breastfeed their babies haven't always got the support to continue this. In busy working schedules alongside the many other challenges that modern women face can mean that women don't always feel that breastfeeding their child is something that is an accessible option to them. Then next, about campaign. This campaign has been chosen because this year we want to really recognize breastfeeding moms, ensure they are seen and heard and share relatable human experience about breastfeeding and the importance of multi-level support. This support includes first of all, policies and attitude that value women and breastfeeding. So in that word policies we have to make family friendly policies and we have to counsel the mothers for breastfeeding. We have to provide the maternity leaves to mother. We have to give extra support to the mothers. Then second is a women and breastfeeding friendly healthcare system. As you read all the BFHI guidelines, we have to follow that guideline. We have to initiate baby friendly hospital initiatives. Then third is respect for women, autonomy and her right to breastfeed anytime. We have to give more and more respect to women. We have to protect her rights. अकॉर्डिंग टू ह्यूमन एक्ट लॉ के अकॉर्डिंग ये चीज है कि कोई भी ब्रेस्ट फीडिंग मदर अगर कभी भी किसी भी जगह पर वेदर इट इज इन गवर्नमेंट सेक्टर, प्राइवेट सेक्टर और इन कम्युनिटी कहीं पे भी वो ब्रेस्ट फीड करवाना चाहे, सो दैट इज हर मेन राइट टू प्रोटेक्ट ऑल द राइट फॉर ब्रेस्ट फीड. She can raise her voice regarding breastfeed. Then next is solidarity and community support. We have to give more and more support from families, neighbors and community. That is very essential. So that is all about this campaign. So next is purpose of theme. So main purpose, first purpose to highlight the health and well-being benefits of breastfeeding. The next is it is an important source of nutrition. As you all know, the breastfeeding provides all the source of nutrition to the babies. Then third is to improving the health and babies and promoting, protecting and supports the right of women to breastfeed anywhere at any time. As I discussed earlier, mother can breastfeed anywhere at any time. The last purpose is Breast Week aim to raise awareness of the health and well-being outcome of breastfeeding and the importance of supporting mothers to breastfeed for long as they want wish. The next is key message. This is the last about my slide. The key message by this theme, the first message is let's appreciate breastfeeding moms and ensure they get the support they need. Firstly, we have to appreciate mothers. Anywhere and work to improve the position and condition of women at home, at work, and in public life. So this is all about this theme, key message. Then in last, I want to say some few words. Further, more and more information will provide by all the resource person. In last, I want to say that some few words for mother and baby. Mother's bottle, his stomach and breastfeeding fill his soul. So that is all about my slide. Thank you, ma'am. Thank you all the
Thank you so much, ma'am. Thank you for connecting us with the theme of conference. I would like to request you, ma'am, please come upon the stage again for your felicitation. And I would like to invite Ms. Neha Sharma on stage to felicitate Shubhangini, ma'am. Thank you so much, ma'am. So, moving forward, our next session is on global perspective of breastfeeding. For this session, I would like to invite Dr. Kanchan Bala, Associate Professor at Swami Rama Himalayan University, Dehradun. It's now time to introduce our esteemed speaker. Let's watch a brief introductory clip about Dr. Kanchan Bala.
Dr. Kanchan Bala is an esteemed Associate Professor and Chief Infection Control Nurse at the Himalayan College of Nursing, Swami Rama Himalayan University, Dehradun, Uttarakhand. With a PhD in Obstetric and Gynecology Nursing, she brings 21 years of dedicated teaching experience to her role. Dr. Bala has guided numerous UG, PG and PhD students in their research and has published 26 articles in esteemed national and international journals. Her
Allocates include the Best Young Researcher Award 2015 and the Best Teacher Award from SRHU 2023. A lifetime member of TNAI since 2001, she has been an active member of the Academic Council at SRHU. Dr. Bala has been a guest speaker at various workshops and seminars and has independently organized numerous conferences and seminars. She has a notable presence in community out research programs, particularly in obstetrics, and continues to make significant contribution to both academic and clinical nursing. Dr. Bala's research interests including nursing, education, obstetric and gynecological nursing, and infection control. Currently, she also serves as the academic coordinator for the post-basic BSc nursing program. Please join me in welcoming Dr. Kanchan Bala.
Good morning everyone, and thank you so much for a wonderful introduction. So let us start with the topic directly, which is global perspective of breastfeeding. So as we all know that breastfeeding, it is a natural and universal practice which is very important for the newborn baby as well as for the newly mother. So it has health implications for both infants and mothers, which is recognized by various organizations like WHO and UNICEF. It is a best method for the infant feeding, which provides unmatched nutritional and immunological benefits. As we all know that breastfeeding and the colostrum has IgG and IgM present there, which help us to boost up the immunity of newborn baby and which we carry forward till our end of our life. So it gives us immunity basically. So sir has also mentioned that initially colostrum was not like people were not fond of giving that yellow milk. लोग पहले कहते थे इसको वेस्ट करके फिर जो white milk आता है वो देना है. But अभी वो myth hopefully khatam ho gaya hai, but still there are few areas. I hope that we'll cover that also very soon. So this is very important to give colostrum to the newborn baby. Despite its importance, global breastfeeding practices and rates, it still vary widely, influenced by there are cultural factors, economical factors, and there are various social factors. So as we all know, there are many benefits of breastfeeding, as breast milk contain ideal balance of nutrients for the newborn baby and also prevent the mothers from any kind of infections, further infections. Then it also provides antibodies to help the baby protect against the infections and diseases such as diarrhea, pneumonia and various other diseases. It is also, it has been seen in various studies that it is also associated with the IQ score and better educational outcome in their lives. For mothers, it promotes faster postpartum recovery by helping the uterus return it to pre-pregnant stage. As baby is on breastfeeding, this will help mother also to obesity and type 2 diabetes in children, adults. It also enhances the emotional health and resilience in the children. Let us talk about the global breastfeeding rates. So according to WHO, only about 41% of infant worldwide, so you can imagine 41% out of 100% are exclusively breastfeed for first 6 months. I hope everyone knows what is exclusive breastfeeding, where only breastfeeding is given for first 6 months without even intake of water. So high rate of exclusive breastfeeding are observed in countries with strong cultural support and breastfeeding policies. So whatever policies we prepared, in implementation we require a coordination in the society. We need their cooperation. So challenges, if any implementation is there, people has to face the challenges like misinformation. अगर आप गलत इंफॉर्मेशन बाहर जाके देते हो जब आपको नहीं पता है कि करेक्ट इंफॉर्मेशन क्या है, मार्केटिंग दी ब्रेस्ट मिल्क सब्स्टिट्यूट, जैसे आपने सुना होगा डब्बे वाला दूध कॉमनली बाजार में मिलता है, विच शुड नॉट बी प्रमोटेड, एंड इनएडिक्वेट हेल्थ केयर सपोर्ट. अगर आप लोग community, we all are healthcare worker, it is our responsibility to give proper information in the community. So there is cultural perspective. In many cultures, the breastfeeding is considered as communal activity, that is community activity with family and community member. They also support the new mothers. They and globalization have introduced new attitude and misconception about breastfeeding and their traditional practices. There are various challenges to breastfeeding. The most important is societal barrier. If family members are not supporting, society members are not supporting, it is difficult for the mother. So likewise, social stigma against public breastfeeding can discourage the mother. आपने देखा होगा बस स्टैंड्स हैं, ट्रेन्स हैं. ब्रेस्ट फीडिंग इज अ प्रैक्टिस वेयर लेडी नीड्स अ प्राइवेसी. शी शुड बी गिवन दैट प्राइवेसी सो दैट शी कैन फीड द बेबी. Economic factor, the pressure to return with work if they are working mothers. For them it is difficult. Now 6-month maternity leave is there, but still after 6 months also mother have to feed the baby. But in few private organizations where they don't give 6-month maternity leave, they give only 3 months, somewhere it is only 1.5 months. So for them it is difficult. Then health issues, if mother will not feed the baby properly, then conditions like mastitis, latching problem, insufficient milk supply, it can again create the breastfeeding problems to the mother. Then lack of support, as we have seen in societal barrier, same cheese, insufficient lactation support and counseling from the healthcare providers. If mother, especially primary mothers, they need more guidance. Mothers are already having experience for one baby. So if it is primary gravida and she is living alone with her husband and she is not in the joint family, for her health care worker should take the responsibility to train the mother for the breastfeeding techniques. Then comes policies and initiatives. There are many policies and initiatives have been taken by the government of various agencies like WHO and UNICEF. As Shubhangini ma'am also mentioned about baby friendly hospital, they have given 10 steps. So every hospital should follow those 10 steps so that we can enhance the breastfeeding support. There are successful initiatives in few of the countries like Brazil. Brazil at the highest number who have implemented all the program related to breastfeeding. Then Bangladesh, community-based peer counseling program have successfully supported there in Bangladesh. Role of healthcare professionals. So being a healthcare professional, what is your role when we are talking about the breastfeeding? The most important is we need to aware the mother about the breastfeeding, the benefits of the breastfeeding techniques, various positions in which mother can feed the baby. And what is the timing? Like we say, it is always on demand and every 2 hourly. If not less than that, at least on demand. जब भी बच्चा रोता है, मदर को ये नहीं देखना कि 2 घंटे अभी हुए नहीं हैं. She should provide the feed to the baby. Healthcare provider, they plays a critical role in educating and supporting the mothers about the breastfeeding when they are with you in the hospital. Training program must be done. Healthcare worker भी तभी बताएंगे when they are being trained. So we, in our curriculum, there is a breastfeeding practices and everything is being taught to you. So we should learn properly, train properly so that we can train the mothers. Encourage hospital to become baby friendly. जो 10 steps I told you. Then implementing the practices which can make a significant difference. So there are various technologies for the breastfeeding. There are various apps where you can count the breastfeeding times and how many times mother have given the feed. She can save in that app, providing breastfeeding tips, connecting mothers with lactation consultants. Online they can talk to. I'm sorry, my throat is. Sorry. So they can connect with the lactation consultant, which can be anyone who can teach the mother related to the breastfeeding. Then online communities are there. There are various forums, social media groups where she can seek the advice. There are various innovations is there in the market. There are, for example, breast pumps. If mother is not able to feed the baby, she can always extract the milk and give it to the baby. It should not be wasted, but can be given to the baby with the help of palliative or spoon feeding. So, in sustainable development goals, there are 3 goals which is leading to the breastfeeding practices, like 2, 3 and 5. 2 says zero hunger, provide natural sustainable source of nutrition. 3 says good health and well-being, which improve maternal and child health outcome. And 5 says gender equality. Either male or female baby, we should support for the breastfeeding. So there are various researches which are going on for the neonatal mortality rate. We are assuming that will in Haridwar only one project is going on in ICMR to reach the single-digit neonatal mortality rate. I am one of the part of that research, and we are dealing with Haridwar, Rohalki, this area. We are going to start the work. Pilot study have been already done. So in that, exclusive breastfeeding is one of the most important factor. So to conclude my topic, the breastfeeding, it is a vital practice which supports the health and well-being of the infant as well as the mother. By understanding and addressing the cultural, social, economical factors, we can enhance the breastfeeding support globally. Advocacy, education and policy changes. These are the 3 crucial aspects we should work on to improve the breastfeeding rates and supporting the mothers. I hope the topic is clear. It is global view, but we need to concentrate more in India as we are residing here. So India should get the more breastfeeding rate. Currently, we are only, I think 41% of mothers, they are exclusively breastfeeding the mother. By 2025, it has been declared by WHO that at least 50 to 55% mothers should breastfeed the babies. Still, we are at only 50% level, which should go up to 100%. So I have prepared a small quiz. I hope that you will be able to answer. Shall we? So first question is, what is recommended duration of exclusive breastfeeding as per WHO? Okay, everyone has to answer. Yes, very good, 6 months. Second is, which global initiative aims to promote breastfeeding in hospitals? A, B, C, D? B. Good. Which of the following cultural factor can influence breastfeeding practices? Family support, traditional belief, modern influences, or all of the above? Very good. How does breastfeeding contribute to sustainable development goals? Support zero hunger, promote gender equality, improve maternal child health, and all of the above. आपके बच्चे बहुत इंटेलिजेंट हैं. What role do healthcare professionals play in breastfeeding support? A, B, C, D. Good. Which country has successfully increased breastfeeding rate? Why is breastfeeding considered environmentally sustainable? Good. सब जीत गए. Thank you so much.
Thank you so much, ma'am.
If you have any query, you can ask.
Thank you so much, ma'am. Please kindly stay on the stage for your felicitation. I would like to invite Mr. Rohit, Associate Professor, on the stage to felicitate Dr. Kanchan Bala. Please, sir, come forward to the stage.
And I'm so sorry for my throat.
Thank you so much, ma'am. The session was really invaluable. Except your health was unwell, but still, your knowledge was truly stand out. Thank you so much, ma'am. Up next, we have a session on breastfeeding and their initiation. For this session, we have Dr. Lata P, Principal, Jyoti College of Management, Science and Technology, Bareilly. She is also NTAI, International Association of Oncology member. Before the session, I would like to request our IT team, please play the introductory clip about her.
It is my distinct pleasure to introduce Mrs. Lata P, a distinguished professional in the field of nursing, with a robust career spanning over 17 years. She has significantly contributed to both clinical practice and academic excellence. Mrs. Lata is currently pursuing her PhD in nursing with a specialization in obstetric and gynecological nursing at Desh Bhagat University, Punjab. Her academic journey began with a bachelor's degree in nursing from Meenakshi College of Nursing, Chennai, followed by a master's degree from Apollo College of Nursing, Chennai. She had held several pivotal roles, including assistant professor at Dr. Shamlal Thapar College of Nursing, associate professor and HOD at Maruti College of Nursing, and professor at both Narayana College of Nursing and ES College of Nursing. Her most recent leadership roles include serving as principal at Nishad College of Nursing and Allied Sciences and currently at Jyoti College of Management, Science and Technology. Mrs. Lata has an impressive record of academic contributions with 77 publications to her name, including 66 international articles. She has presented 21 papers at various prestigious conferences and has earned several accolades such as Indian Youth Icon Award 2023 and Global Educator Excellence Award 2022. Additionally, she has served as an editor for multiple esteemed journals and as a resource person at numerous international webinars and conferences. Her dedication to the nursing profession is further exemplified by her involvement in significant research and academic activities, including her dissertation on the impact of air pollution on the birth weight of newborns. She has also made notable contributions to nursing education through various online courses and FDP programs. Please join me in welcoming Mrs. Latha P, a paragon of nursing excellence and inspiration to us all.
Good morning, respected dignitaries on the dais and faculties from Care College of Nursing, HODs and other respective dignitaries and participants from various colleges. So warm welcome at this holy place Haridwar. So feeling happy and to be present at this holy place with good-hearted people like you all. So thank you for the management of Care College of Nursing and Shubhangini ma'am for giving this good opportunity for me to present here. So let me proceed with the topic here. So my topic is given to speak is initiation of breastfeeding. So coming to the initiation of breastfeeding, so when we supposed to initiate the breastfeeding, already we have discussed detailedly. So as per thing like when a mother have a normal delivery, so the book says like within 30 minutes we can initiate the breastfeeding in case of normal delivery, and within a 1 hour, at least within 2 hours after following the cesarean section. So how early we can initiate the breastfeeding, so that much good for a mother as well as for the baby. And also like after the 6 months, we have to talk about only exclusive breastfeeding. So other than breastfeeding, nothing should be given. No water, no any other pre-lacteal feeds. Okay, so olden days, everybody is talking about the traditional practices which were being followed. They were giving sugar water before, and they were discarding the colostrum which was not white color. It was kind of yellowish color. So they feel it is unhygienic or it is not a pure one. So that's the reason they were discarding, and they will wait till the white transition milk is coming. So after that they started feeding. So that was really a misconception in olden days, but nowadays everybody is aware. Even we are studying in the syllabus, and also healthcare workers, they are mainly playing a key role to promote this awareness among the public who's really not had a formal education. So this is a thing. So 6 months is exclusive breastfeeding. Other than milk, nothing should be given to the baby after 6 months. Along with the milk, we have to start the complementary feeding. That is, additional feeding should be given by having whatever the the traditional food, whatever we can give to the soft solid diet, we can initiate along with the breast milk. And maximum to maximum, as per minimum you have to give 1 year of breastfeeding should be continued, because it has got a lot of benefits physically and also mentally, emotionally, a lot of benefits. So minimum to minimum it has to be 1 year, it has to be fed, and maximum how much of a mother feel comfortable, how many years the baby demands. So as long as it comes, you can give. It's like a water in the well. How much you get, that much will be benefited. Okay, so this is a thing. And coming to the exclusive breastfeeding, so I said exclusive means only. Nothing else should be given up to 6 months of age. So benefits, we have benefits for the mother as well as for the baby. So this is a first comes to baby. It is a essential and one and only food for newborns, unless if there is any contraindication, like mother is having some health issues where the breastfeeding cannot be given, or the baby is having some issues where the baby cannot take the feed from the mother though the milk is ready. So only in such a contraindicated conditions we have to think of formula feed, or else sometimes some based on the tradition they go for cow's milk also. But otherwise, in a normal conditions, it has to be encouraged for the mother, because as it is going to contribute most of the advantages, like it gives a proper complete nutrition, it having high Q, and also the baby will not develop obesity in a childhood obesity, as it have all the nutrients in a basic level or it's a proper level. And it also prevents infection, as madam said. It has got a IgG and IgM antibodies which it fights against infection. And also it gives a basic immunity, because there are types of immunity, right? Something we have innate immunity which comes from the time of birth, that comes through the placenta. From the mother we get some innate immunity. Apart from that, we have some passive immunity where we get through the immunization, vaccination. Okay, so this is a basic immunity we are getting either by native or by the passive method. So it's going to give you the basic barrier or its protection against all the chronic and infectious diseases, and it's freely available, cost effective, and it also creates a bond between the mother, love and affection. Okay, skin to skin contact. The baby feels security. Somebody is holding you, like when you are in a problem, if some friend is coming and hugging you, you feel so comfort. You feel feel like you are so loved and affected, somebody is there to take care. So same role the breast milk plays. So that's the thing, it's very much important. Okay, so it is easily digestible, because it has got all the basic nutrients in a optimal level. So that will do the function, not like a formula feed. So it is overall it's very much beneficial. Coming to the mother, so like once the mother is having a regular breastfeeding, first and foremost is it helps to involution of all the reproductive organs. That includes the uterus and extragenital, etc. Okay, so all the organs will go back to the pre-pregnant state, that we call it as involution. Okay, that is called puerperium. It takes around 1.5 months to all the organs to go back. So that is going to give you, like once mother will have a proper feeding, that also it will stimulate the pituitary to maintain the proper hormone levels. Okay, so that is a prolactin is a hormone which mainly initiates and helps in the breastfeeding throughout the breastfeeding time. So that also helps oxytocin to produce from post-pituitary. So these two hormones plays a major role to maintain the postnatal period, as well as we have two hormones like FSH and LH, follicle stimulating hormone and luteinizing hormone. These two are, and also estrogen, progesterone. So estrogen, progesterone maintains the pregnancy, FSH, LH that maintains the ovulation, and prolactin and oxytocin that maintains the postnatal period. So once the mother is doing the proper milk breastfeeding, so that allows all the hormones to play its role better. Okay, so the mother will not have any postpartum complications like PPH, etc. So she will not have any anemia also. And like that because of the prolactin oxytocin hormone limit the role of FSH, LH in the postnatal period, so that how long she breastfeed, she may not get a ovulation and menstruation. So that's why breastfeeding promotes natural, it's a contraceptive method. Okay, so how long breastfeed? You will not be fear of any pregnancy. So that is, we call it as, it's a lactational amenorrhea also. And it also gives a protection against the breast cancer and all the reproductive cancer, because these are the cancers highly prone to get up for the menopausal women, because what happens in the menopause, all the hormones started declining and all the systems, they are going to get a lot of problems as the age is increasing. So this one, the hormone will again maintain the same level. So once your reproductive organs are active, even sexually active, even you are keeping your the hormones under control, so till that you will not have any fear of any promoting cancer. Okay, so thereby it also reduces the risk of cancer when you are sexually active, when you are in the reproductive age group. So these cancers are more common after the reproductive age group, that is above 40, where the menopausal women. So that's the reason the government of India is continuously encouraging all the once you cross the 40, at least annually or every 6 months once or annually, at least you have to go for the pap smear, mammogram, whatever. So you should screen out whether the mother is going for any kind of reproductive cancers. And yeah, ultimately it promotes the bonding between the mother and baby. We call it as KMC, Kangaroo Mother Care. So hope you are seeing kangaroo, how it carries the baby in the this one, in the abdomen. So nowadays you can see the visible example is monkeys, right? Monkeys also taking the baby in the same way like a kangaroo. So that also same. How much fast the monkey run, still the baby have a confidence that I will not fall down, right? So it have complete affection, love, the confidence on the mother that she will take care of me, so she will not allow me to fall down. So that is a live example, because every day we see monkeys, so I really think of how mother and baby is attached together. Okay, so that is also one example, that's emotional. And for breastfeeding, you needs no need of any preparation. Formula feeding, you know that you have to see the composition, how much you have to take a water, how much you have to take a formula feed, you have to mix it, and how boiling the feeding bottles, and hygienic practices, and what is the formula feed, and how long you give the formula feed, and that is childhood obesity is more higher in the formula feed or in the cow's milk than compared with the breast milk, because it has the proportion of the nutrients may vary, and they want to once the baby is taking the artificial feed, they want to put on weight, though lower weight babies भी weight अच्छा से बढ़ जाता है उसकी वजह से. So it's a marketing of their business, like okay, it's giving good weight for the baby, so it's not a healthy one actually. Okay, so here, but one thing I want to tell you for preparation. Okay, so though the mothers, everybody is having basic knowledge, like they have to give a milk within half an hour, 1 hour, and every 2 hours, demand feeding, supplementary feeding, etc., all is right. But what about the hygiene? What? Because even the educated people, they are not filling hygienic practices while you are going to give a breastfeed. And especially, you see in many of the hospitals or roads, wherever you see the people who are underprivileged people, poor people, uneducated people, you see how the style of breastfeeding. They don't clean the breast before giving milk. So before and after feed, you have to at least take just a water, take some clean cloth, just wet it in the water, squeeze it, and just give a nipple, primary areola and secondary areola. Just give a basic cleanliness just before feed, because our dress is sweating and we are traveling. We may be anywhere. Okay, so it has to be, most of the people, they don't think. They are wherever you feel, you just see, they'll just open the dress and they'll start feeding. Nobody think of the hygiene to be practiced before and after feeding. So this is, please, being as a healthcare professional, we have to, when you see someone is doing like that, you please, and whenever you are going to, especially government hospital, you are going to posting, you tell the mothers, okay, giving feeding is right, but see, give in the good condition, so that the baby should get the ultimate or complete benefit out of the breastfeeding. So please, you can, you just please make a stress on this point whenever you see the mother, especially underprivileged population who don't have this one. So, and though they know, they are not following it. Okay, so this has to be done, just a simple water before and after. Okay, so that will give a big benefit to the baby. So this point I want to stress here. So society like when the mother is healthy, the family is healthy. Family is healthy, the society is healthy. And the society is healthy, the government, the local government, they don't need to invest so much money to take care of these people's disease condition. They have to prepare new programs, invest some big amount for that. So this is what ultimately. So if you are healthy, so it will the government burden will be come down, so that this investment they can do in some other effective educational etc. Okay, so this is why it will be helpful if you are healthy. So it will promote helpful for the society also economically and as well as thing. So this is thing. So let us see some of the hurdles or some factors which is really disturbing to successfully executing the breast milk. One is lack of family support. Already madam has discussed. Okay, so family support is very important, especially husband, because nowadays all the mothers have started working. Okay, so she can't alone take care of the baby 24 hours and she also need to work. Okay, but so what it is, we were in a joint family, we could one or other, okay, okay, what I say, Chitani, they were running something, So they were one by one, they take care of the baby, okay, in a row, time wise. But nowadays, we love to have a nuclear family where we can get up late in the Sunday. When Sasu is there, that is not possible. So we are completely enjoying the nuclear family benefits. So we have lack of people to support. And most of the people, husband and wife are yearning, and most of the babies are taken care nowadays by the worker. Okay, so once they come, they go to office, she will come, and once they come, she will go back. So most of the babies, caretakers are taking care of a baby. Okay, so that is a thing, but still there are, breastfeeding supporting institutions are there. Okay, there must be some baby care center in the inspection. One of the criteria, like you should have a baby breast milk feeding room in the college or in the hospital. Also, there must be some baby care center also. Okay, 3 months, 6 months. Okay, after 6 months, she has to continue the job and she has to bring the baby, and somebody caretaker must be there in the available college or whatever, so they can do. But that is not a practice to most of the people, and many of the private colleges, they don't give up payment, so there are a lot of issues. So family support, though somebody is taking care of baby, it may be a mother or it may be a caretaker, but there must be an ultimate family support, okay, in the form of regular breastfeeding. And lack of support by the health professionals. So we are educated people, we must follow the breastfeeding technique, cleanliness, etc., so that we can teach the other people. So we have to have a thorough idea. So madam was telling about BFHI 10 points. Okay, hope you 4th years might be knowing what are the 10 points. I'll review also, but still it has to be followed wherever you are doing. Okay. And the mother, ultimately she is the one, because most of the diseases in our body controlled by the hormones. The stress is one of the important factor which is going to contribute so many diseases in the body. So when the mother it may be first baby, it may be second baby, it's a male or female, no matter, but she has to maintain her happiness, confidence, love and affection towards the baby. How much she loves, that much she feels to give breast milk to the baby. And this is ultimately controlled by the hormone. Okay, if she's on stress, having some family issues, okay, and she don't like the baby, or it may be accidental delivery, like she did not have a baby, but failure of contraceptive, she got pregnant and she got a baby. Sometimes they may show aversion towards the baby, that it is unwanted child, something like that, maybe. So whatever the matter, the child is a child has all the right to take its nutrients from the mother. Okay, so it's illegal or illegal, whatever kind of, but it has to be taken care of properly. So mother, she has to have a complete strong confidence and also love and affection when she wants to breastfeed, so that how much she is happy, that hormone, everything will be in an optimum level, which will do the function well, the breast milk secretion, and also regular feeding will also promote the secretion of hormones and milk, etc. So this is a main thing. It is in the mother hand how she is going to maintain the breast milk. So there are some do's and things. So here it has to be, as I said, for normal delivery within 30 minutes and for cesarean within 1 hour it has to be initiated. Do not give any pre-lactal feeds like sugar water, plain water, etc. Only the breast milk to be given up to 6 months. After 6 months you can start your complementary feeding along with the breast milk, and it has to be minimum of 1 year and maximum to 2 years you can give a breastfeed as long as mother is feeding, and no more bottles and pacifiers, etc. Because sometimes even I had a twin baby, I was not getting adequate milk secretion, so we managed it so much with a artificial pacifier. Because whenever baby is crying, I have to manage them. So, but once they habituated with the pacifier, so they will have a, because that we are not going to give you full bottle, only the nipple will go to the mother, baby's head. But when we go to the real breastfeeding, so we have to include the nipple, the primary areola, secondary areola, at least the primary areola. It has to completely go on the baby's mouth. So, because there is a difference, the baby may not feel comfortable to take a big part like a breast. Okay, so it will be more comfortable with only bottle feed than comparing with the breast milk. Okay, so that's a confusion baby will have, and it may not, it has to take energy to take out the milk from the nipple. So that takes some, baby has to put some energy. So baby may feel lazy or something, feel less energetic. So baby prefer to have a artificial bottles. Once you start it may not be comfortable, and that create a nipple confusion also. That's the reason for a normal conditions where there's no contraindications, where no difficulties. In normal conditions you have to like you should not have any kind of bottles, artificial feeds, etc. unless it is contraindicated. Okay, and breast milk, so minimum every 2 hours you can give a breast milk, minimum they say 8 to 10 times. Apart from that, there is something called demand feeding. So whenever baby cries, the cries may be for many reasons, but still you have to, is there any babies on any pain? That time maybe baby crying, and number 2, something is biting, maybe the hand, or maybe something, she's having some pain due to some bite or whatever. Third one is maybe the hunger. So these are the 3 reasons where the baby cry. Okay, you have to differentiate for what the baby is crying exactly. Okay, so whenever the baby cries for hunger, and you have to be ready to give to the baby. And breastfeeding should be in the correct position, the technique, positions that I'll be discussing later. And the mother should have, and that's what, even though mother is having problem with the breast milk secretion, she should have a strong confidence, like I can manage, I will feed my baby somehow. So this kind of encouraging, confidence must be there with the mother, so that the healthcare people will be working. There are some drugs also which is there to promote the breast milk. Okay, and also to suppress the breast milk, lot of products are available. Okay, so these all can be used for the mother to create a confidence in a breastfeeding. So this is a 1 hour. So no prelactal feeds. So already I told you nothing. This one. So demand feeding already I said. So these are the things how you will give the baby correct position. So you can see the image, like the baby has to. So this one you can see the baby has to take a nipple as well as the primary areola together. It has to go in the baby's mouth, and there should not be no gap. Okay, between the nipple, between the breast and the baby mouth, there should not be any gap. If the gap is there, the air will be going inside, so that will be fulfilling the baby's stomach, and within some time, baby will feel full of stomach because air is also filled. So baby feel satisfied and it will stop taking the feed. So you should not never give a gap between the nipple and the baby mouth, so that it has to give a complete latching on technique, so that baby will have adequate feed. Once the baby really had a adequate feed, then baby will some baby will sleep on the nipple one, on the feet, and also the baby, sometimes the baby will feel yawning, and sometimes the baby, sometimes they'll give you, some sound, okay, I'm comfortable, I'm done, So these are some signs will show you that baby had adequate feed, then you can quit the feed. So these are the, whatever I said correct position, opposite whatever you do, it's all in proper position, okay. So mother should have a confidence in the antenatal period. See, when you do the antenatal assessment in the pregnancy, that time itself we will be assessing the nipple condition, how it is, whether it is good or suitable for breastfeeding or not. We will be analyzing when she comes for the first antenatal visit. And after that, when she have any problems with the nipple, like it may be a short nipple, it may be, some mothers will have flat nipple or short nipple, which is not, it has to be prominent, it has to come outside, so that it will be easy for the baby to take feeding. So whenever you find some mothers with some problem in the the anatomy of the breast or some problem in the nipple. It may be sometimes sore or cracked nipple, that is ulcerated. You have to go for antibiotic treatment in the antenatal period itself. It has to be get ready for the postnatal period to be available for breastfeeding. So whatever the nipple problems she have, it has to be, if it's a short nipple, sometimes we follow some traditional method, like we tell the mother to do oil massage every day so that bring out the nipple little, so that somehow it will be somewhat ready for the thing. So there are other lot of practices, whatever any nipple conditions are there, problems, so it has to be rectified in the antenatal period so that it will be, baby will not be suffering in the postnatal period. So these are the breast milk production, how it produces. I already said the prolactin and the oxytocin. Every time when the baby is put on the nipple, baby starts sucking, the nerve impulses from the nipple, that is going to the pituitary. From the pituitary, it promotes again oxytocin. Okay, again, so prolactin and oxytocin like a friends. Okay, so like prostaglandin and the estrogen in the pregnancy, they both are friends. They will influence each other. Same way here, the prolactin and oxytocin in the postnatal period, they are like friends and they will influence each other. And for this companion to continue, you need the baby to be on regular continuous suckling process, so that it will, both the hormones will play the role, and you will have a mother will have adequate milk secretion, and the baby also. So now see, the production of milk will be controlled by the prolactin hormone, and how much it is produced, it is available in the breast, how it is going to come out. So that will be maintained with the oxytocin, because the role of oxytocin in the antenatal, it going to give a uterine contraction of muscles. Okay, so same thing, they will be contracting the myoepithelial cells of breast tissue, so that whatever the milk inside, that is going to come outside, and baby also be ready, put little initiative to take the milk outside. So these are the two hormones has to work accordingly, so that the breastfeeding can be successful. So, okay, so this mechanism we call it as let down reflex, or one more, I forgot. Yeah, oxytocin reflex or let down reflex. Okay, let down, let the milk that come down by the oxytocin. So the same thing what I told you, right? But for that, mother should be stress free. The hormones, mother when she is in pain, if it is cesarean mother, she might be paining from a wound, a cesarean wound. So the pain management should be done, and she should not have any worry, whatever the family issues, whatever. But at the time of feeding, she has to be happy, so that the baby should be get ultimate benefit. And stress, okay, she have any other physical problem, maybe any pressure, any whatever the stress may be, it has to be, and doubt. Okay, if she is uneducated and she cannot follow the instruction, she don't know how to keep the position, technique, cleanliness, etc., etc. This all has to be educated. That's what we are stressing in people. But still, the people, whatever the doubt, they have to clear all the doubt how to, especially for the primary gravida mothers, where they have first experience to handle the baby. Okay, so they have to be adequately trained and educated about the breastfeeding. Okay, so that thing, so not telling, just to show the way they have to do. First time, just to whomever posted, you are going to the posting. So just to take the baby, show them how to, they have to hold the baby, how the techniques, you just practice, because we already the proverb, right? When you see, you may forget. When you listen, it will be maybe less chance to remember. But once you see the demonstration, how to do the technique, okay, so the practice will make to keep a remember for a long time. So this is for everybody, educated, uneducated people. So whatever you are telling, health education, telling will not work out, then you do it and show. Okay, so that will give a really benefit to the public. Okay, so here self-confidence, that's what. So you should not have an overconfidence also, like baby is okay, done, fine, it's over. 10 minutes be. If you give up 10-15 minutes also, but if the baby is not having adequate milk, then it's merely waste. Okay, so you have to make sure the baby had adequate feeding or not. So not matter how long you are giving, but how effectively you are giving feeding, that matters a lot. So you can see some techniques. Okay, so I told you, like the mother, the primary areola and nipple, both completely it has to go inside the baby's mouth without giving any gap. and come to the different positions. Just you know this, but let me review. This is a cradle hold, which is a common position we use. Okay, and one thing, preferably the breastfeeding should be given in the sitting position. First and foremost is sitting. How we are eating? We are sitting and eating. We are not lying and eating. So you know the reason behind that. Okay, so how far you are sitting? Gravity, it will go to the stomach directly. It helps in the digestion. That all the same thing here. So maximum to maximum, encourage the mothers to give a breastfeed in the sitting position. Only in conditions like mother had a cesarean section, she had any other cesarean operation, she's on pain, having some lying position or semi-folders or whatever. Okay, but preferably sitting position is must. So this is a cradle hold position. So always think the head must be higher than the abdomen. Okay, so that this one. So, okay, baby head, it has to be supported by the elbow and the body should be by the forearm. Okay, and this is how you go for that. This is a common position we use. And always when you feed for the patient, for adult or human, I mean the baby, the head must be always high so that it will go as per the gravity, no regurgitation, no going to the airway tract, etc., etc. Okay, so this is the first position, cradle hold position. Second one is football hold position. So this is like football, how we hold it in the hip region. So same thing. So you can just hold it in the cross. Okay, but same thing. The head must be high on the elbow, and the baby will be held on the another hand, like a football position. So this is the second. Third one is sideline position. Like that is mother is in lying position, baby also lying position. But you can notice here in this pic, the baby head is low. Okay, that is not should be done, but the baby head should not be, it should be kept on your elbow. Again, little bit higher, but please correct it. So this is a sideline position, and this is a cross cradle hold position. Okay, so like in this also can be done. Okay, so opposite to opposite you can have it. Some people, they have twin babies and all, they can do football position on both the babies, can take a feed at both the breasts. Okay, so there are a lot of things. And the next one is Australian hold position. So this is also same thing like a sitting baby, but this is already its name is Australian hold. We are not practicing in India, but whatever maximum sitting position, and baby should be supported well. So this is the ultimate aim of breastfeeding. So we can feed whatever you feel like, supporting with the pillows, sideline, etc. But this should be the thing. So how we will say the baby successful breastfeeding? So already I said to reach a successful breastfeeding, the exclusive breastfeeding, demand feeding, complementary feeding from 6 months, and there's no artificial products, items, but only thing, when the mother is having problem with the breastfeeding, like milk is there, but she have a poor milk secretion, we have a breast to support. If the milk is there, but baby is not having, like preterm baby having poor sucking reflex, so that baby cannot put the energy to take a milk outside. So what we do, we have a nipple shield, it can be attached to the breast and you can express the milk. If it can be done manually, so like manually also mother can express, she can use by using a spoon or Faraday, etc. So there are some things available to support the breastfeeding devices. Those can be used but not for the feeding. You have to use less, think of cow milk or products. Okay, so newborn deserves the best nutrition, improved survival and optimum development and healthy life. These miracles can be done only through breastfeeding. So already, finally I just want to have a 10 points of BFHI. With that I will conclude. So as you all know, 1991 they have started initiating this BFHI, Baby Friendly Hospital Initiative. This is one of the important short note you will expect in your short answer in the final examination. And by the collaboration of WHO and UNICEF, United Nations Children Emergency Fund. So these together, 1991 they planned, and 92 it is started, came in the act, and they have a 10 steps because only thing we are giving awareness and education, but you should know what are the 10 points, not only for the mothers just telling. Apart from that, there are some other points mentioned in this. So let me read once. Have a written breastfeeding policy wherever there are, like it may be in the hospital, it may be in the college, because we are only focusing on the hospital. What about the mothers who continue breastfeeding in the college, or it may be in some other area, community, etc. So wherever mothers are there to give a breastfeed, there must be standard protocol, like we have so many emergency protocols in the absence of doctor. The nurse can act immediately by following the protocol standing orders. Nobody will question you why you did like that. So there are some permitted standing orders, protocols for like other conditions. We also should have for the breastfeeding. It must be everywhere. It is like a poster, it has to be displayed. Any public can have a read on that. Number 2, all the people who are in the breastfeeding. So being as a worker, it may be how much the embassy nursing doing nurse educated job. Okay, so that much knowledge may not be with the A&M and GM students. So each and every level of nursing personnel, everybody should be adequately trained. They have to attend the refreshment courses on breastfeeding, etc. Everybody should have equal knowledge, especially in breastfeeding. When you are going to educate, you should be knowledgeable to educate. So all the people, healthcare workers, whomever are going to involve in the breastfeeding, you must be adequately educated by attending the refreshment courses. Third one, inform all the pregnant women about the benefits and the importance of breastfeeding. From pregnant time, you have to start teaching. Then only she will be implemented in the postnatal period. Okay. And fourth one, help the mothers initiate breastfeeding within 1 hour, 30 minutes to 1 hour within the delivery. That I already said. Though she is telling of pain, but you have to make her somehow to initiate the breast milk. Show the mothers how to breastfeed, like what are the technique, position. Okay, all these things also should be taught to the mother. And give the newborns no pre-lactal feeds other than breast milk. And you have to practice rooming in. Rooming in, like think about it's a KMC. How long the mother and baby together, that much it's benefit. Baby feel comfortable, save love and affection, safety, security, and ultimately the warmth. Baby, all the extra-uterine life is different. Initiate breastfeeding and no artificial products specified should be used. And finally, you have to give a breastfeeding support groups. Whenever, see, we have a lot of so many WhatsApp groups. Okay, in the community also have some group by the healthcare workers, have some common group, whomever having any doubt, and you also supervise the breastfeeding, whomever having the doubt, they let them share their doubts. If they especially have some problems with the feeding, what I can do if I have this kind of problems like that, let them have a lot of questions asked, and it has to be rectified so that they will give a breastfeeding. 10 points of baby-friendly hospital initiative. So I think I have taken a lot of time, but listening, and thank you all.
I will request you to stay on the stage for felicitation. I would like to invite Mrs. Shubhangini Sharma ma'am on stage to facilitate Dr. Lata P ma'am. Please ma'am. Thank you, ma'am. Thank you so much for the clarity and precision of your remark. As the ma'am earlier said that bottle fills his stomach, but breastfeeding fills baby's soul. So breastfeeding isn't just about milk, it's about love. It's such a beautiful journey and it doesn't last long. Now, moving ahead to our next session is about effective lactation and examination of full-term and preterm behavior. This session will be taken by Ms. Priyanka Joshi, Associate Professor, Devbhoomi Uttarakhand University, Dehradun, PhD Scholar, HNBU, MU. Before her session, I would like to request our IT shell, please play the introductory clip about ma'am. Ms. Priyanka Joshi ma'am.
Ms. Priyanka Joshi is an accomplished associate professor at Devbhoomi Uttarakhand University in Dehradun. With 11 years of dedicated experience, she had made significant contributions to academia and research. Ms. Joshi has published 12 research papers in both national and international journals showcasing her commitment to advancing knowledge in her field. She has been recognized for her exceptional work, receiving the Best Research Paper Presentation Award in 2019 and first prize in Research Paper Oral Presentation in 2023. Additionally, she has honored with the Best Teacher Award in 2019 by Metro College of Health Sciences and Research, Greater Noida. Her innovative project on TCS pulmonometry earned her the first prize in Utility Project category in 2023. Ms. Joshi is a lifetime member of TNAI and serves as a peer reviewer for the International Journal of Multidisciplinary Research. Further highlighting her expertise and dedication to her profession, please join me in welcoming Ms. Priyanka Joshi.
The bonding between the mother and the baby. This is the let-down process of lactating, as already ma'am had explained. When the baby are first sucking the mother nipples, it stimulating and giving the signals to the hypothalamus, and the hypothalamus immediately releasing the oxytocin from the posterior pituitary gland for squeezing the breast, and the breast milk will be let down from the breast. So this is the let down process of the lactation. The key aspect of lactations. There are the few key aspects of lactation, and the first is the physiological process. In the physiological process, two processes are there: the milk production and the milk ejection. Milk production, the mammary can produce the milk in response to the hormones and the infant demand, and the hormones is prolactin hormone, right? Milk ejection. Milk ejection release the milk through the nipple, facilitated by the hormone oxytocin, which is released from the posterior pituitary gland. Fine. Nutritional function. In that, the breastfeeding contains the protein, fat, carbohydrate, vitamins, minerals stored to the infant needs. An immune factor provide the antibodies and other immune component to protect against any kind of infection, right? In the stages of lactations, there are the 5 stages of lactation: the mammogenesis, lactogenesis, lactokinesis, lactopoiesis, and the involution. In the mammogenesis, development of the mammary gland, functioning state start from the birth to puberty and continues in the pregnancy as well from the 16th week of pregnancy. The lactogenesis, synthesis and secretion of the milk from the breast alveoli, which occur in the mid-pregnancy. The lactokinesis, promoting the contraction of the myometrium to eject the milk from the breast. Lactopoiesis is a sustained milk production during the breastfeeding, and evolution when the gradually cessation of the milk products when the breastfeeding is stopped by the breastfeed mother. Now the hormonal regulation, the prolactin and the oxytocin is a major hormone for the breastfeeding process. The prolactin is to stimulate the milk synthesis response to the natural hunger cues, as the infant always giving the different kinds of the signal of hunger cues, right? Encourage a consistent milk and help to regulate the infant feeding pattern. The supportive environment should be important to lactation consultation, support the group of the guidance, support the group of the guidance by the family, by the community, the consultations by the gynecologist. So this is the hunger cue, the early cues: strine, mouth opening, and the turning head scene. Mid cues: stretching, increasing the physical movement and hand to mouth. And the late cues is calm me, then feed me, the crying, agitating, and the color turning red. So these are the cues of hunger. Maternal health and well-being, maintaining the balance and stress to support the milk productions. Taking time for the self-care, enhancing the overall diet and managing the well-being. So mothers should be maintaining their diet for the milk production also, and they have to take care of themselves. Monitoring the growth and development, regularly assessing the infant weight gain and developmental milestones. So we have to just comparison the age of the baby as well as the development of the milestone with the feeding. Now adjusting the breastfeeding practice based on the infant changing need. The sign of effective lactation in the infant. If the effective lactation is there, the regular weight gain, a healthy growth pattern, a happy and a peaceful state after the each feed, a frequent wet and solid diaper indicating a proper nutrition intake. So
So this is the effective feeding we can identify in an infant, in a mother, comfortable breastfeeding experience without persisting any pain or discomfort, perception of the full milk supply with a noticeable milk ejection during the feeding, and positive emotional connection with during the time of the breastfeeding process with the mother and baby. Now the examination of the full term and preterm behavior. First we discuss about the full term. So what is the full term? What do you understand by the full term? Now the full term is stated as a 39-week. The American College of Obstetrics and Gynecology and Society of the Maternal Fetal Medicine allows the more specific definition to describe the babies born between 37 to 42 weeks of gestation. In the past, baby born anytime 37 to 42 weeks of gestation we are considering as a term. But there are so many changes that occur in each week of pregnancy after 37 weeks of gestation. So the American College of Obstetrics and Gynecological, they are divided into the term in a 4 stages. Early term is a 37 weeks through 38 weeks and 6 days. The full term 39 weeks through 40 weeks and 6 days. The late term is 41 weeks through 41 weeks and 6 days. And the post term is 42 weeks and the beyond. So now we have to divide the term into the 4 categories. The preterm baby. Preterm baby is defined as a baby born alive before the 37 week of gestation and before the completion of the pregnancy. There were a subcategory of the preterm birth based on the gestation age. Extremely preterm, less than 28 week of gestation. Very preterm is 28 week to 32 week of gestation. Moderate to late preterm is a 32 to 37 week of gestation. So also we have to categorize the preterm in a 3 stages. Now the full-term lactation. What is the full-term lactation? Full-term lactation refers to the process of the breastfeeding full-term infant. Those are accompanied their 37 week of gestation, which is defined as a baby born between 37 to 42 week of gestation. Full-term lactation typically begin immediately after the birth, continuing for several months, with the word according to WHO recommending the exclusive breastfeeding till 6 months of life. Now the full-term infant behavior. What is the behavior of the baby in a full-term lactation? Characteristic is strong sucking reflexes. If the baby is a full-term, the sucking reflexes is strong, and due of the strong sucking reflexes, well-developed ability to suck, to swallow, and to breathe rhythmically. Commonly establish a feeding routine and intervals. The full-term baby can maintain their pattern of breathing, and they can maintain the coordination of the swallowing, of the sucking and the breathing. In the next is a feeding pattern. The feeding pattern is every 2 to 3 hours, and it is maintained by the full-term baby only. We cannot consider to each 2 or 3 hours we have to give the feed to the baby, right? The growth spot may be temporary increased feeding frequency. So depend upon the rapid growth, especially in the infant period, the rapid growth is there. So depend upon the rapid growth, demand also increase, the frequency of the feeding pattern also increase. Effective lactation with a full-term infant. Encourage to skin contact, promote the bonding and stimulate the milk production. Use the variety breastfeeding position to find what is the most comfortable and effective position for the mother as well as the baby. Now the preterm lactation. Preterm lactation refers to the process of breastfeeding of infant before the 37 week of gestation. Preterm infant behavior challenges and adaptation. In that, the immature feeding reflexes. Due to the immature feeding reflexes, preterm infant may struggle with the coordination of the sucking, swallowing, and the breathing, and often tired to quickly and require the more frequent break during the feeding. Right? Reduce the muscle tone. The muscle tone is not that much of responsive, as well as a hypertonicity in the preterm infant. Due to that, they are affecting the ability to lay sustain the effective feeding. Now the technique to support the preterm infant. Now one more thing, the full-term infant, they are maintaining their normal lactation behavior. We are finding a normal lactation behavior in a full-term infant until and unless there is no any medical problem or medical complication, right? In a preterm infant, they are having some issues with the feeding. The behavior is The baby is normal or abnormal? Abnormal. Now the preterm lactation behavior. Technique to support the preterm infant lactation. So we need to sort out these problems, right, to maintain the feeding patterns. So we have to encourage to kangaroo care, skin to skin contact to have to stabilize heart rate and improve the feeding, encourage the bonding and enhance the milk supply. Use the express milk. Supplementary feeding with express breast milk to ensure the adequate feeding may involve the syringe feeding or specialized bottle designed to preterm infant. Nowadays, so many things, the lactation aids are available like the syringe, the bottles for the preterm. By that, the preterm can, they are continuing their proper breastfeeding process without having any extra efforts. Feeding strategies, schedule feeding and lactating aid. So we have to apply these strategies like the schedule feeding. We have to schedule the feeding because in a full-term infant we don't need to schedule feeding. They automatically schedule their feeding, right? Because of their why the full-term are maintaining their full breastfeeding process like schedule feeding. फुल टर्म अपने शेड्यूल फीडिंग कैसे मेंटेन करते हैं? Why the preterm are not maintaining their schedule feeding?
Because
They all are normal. And why the preterm are not maintaining their schedule feeding?
Because they are abnormal and they
Not abnormal actually. The weak muscle tone and the poor reflexes because they arrive before the completion of gestation, right? So the feeding strategies in that, the feeding, scheduled feeding, regular feeding interval to ensure the consistent nutrition intake. So you have to maintain the regular feeding intervals for the preterm babies. Close monitoring of the weight gain and monitoring the milestone. You have to compare as per their age to check their weight as well as to check the milestone. Then lactation aids, you can use a different lactation aids for the preterm babies, like use of the nipple shade or the supplement nursing system to aid the feeding. Breast pump to stimulate the supply and allow to supplement feeding. So this is the nipple shade and this is the supplementary feeding system. Nowadays it's available. Now what is the comparative analysis full-term and preterm behavior? If you are seeing like the sucking reflexes in a full-term baby, well developed and rhythmic, but in a preterm baby, immature and required the support. Feeding frequency, full-term infant can maintain their feeding frequency by 2 to 3 hours and preterm infant more frequent and the shorter sessions. Latch-on ability, typically effective and may struggle with the latch-on required guidance in the preterm because they are having a poor muscle tone and poor reflexes. Nutritional need, standard calorie intake, and in the preterm they require a high calorie nutrition requirement for maintaining their growth and development. Growth monitoring, you can like routine checkup, other routine checkup we can maintain or we can check the full-term infant growth and development. But in a preterm infant, the close monitoring and intervention is needed based on the condition of the baby. Now the variation in the sucking pattern and the swallowing mechanism between the full-term and the preterm. Sucking pattern of full-term, strong rhythmic sucking 1 to 2 suck per second. When a preterm, weak diagnosed sucking 0.5 to 1.5 suck per second. In the coordination sucking, swallowing and the breathing. When the preterm, uncoordinated sucking, swallowing it and the breathing. Sucking pressure is 100 to 200 mmHg, but in the preterm, sucking pressure is 50 to 100 mmHg. In the swallowing mechanism, the full-term mature swallowing mechanism and the preterm having an immature swallowing mechanism. In the full-term, effective milk transfers from the mother to baby, and in the preterm having a difficulty to milk transfers. And why? Why the preterm having a difficulty in the milk transfers? Poor sucking reflexes. Fine. Strategies for enhancing the lactation. So what we have to do for enhancing the lactation, we have to support the mother. And how we have to support the mother? By counseling, by guidance, by family supports, right?
So provide the lactation counseling and support group, offer the education resources on effective breastfeeding techniques, and address the maternal health and the nutrition. In the medical intervention, assist the lactation consultant as specialist, utilize the technology such as the breast pump and nipple shade and aids feeding upon the requirements and demand. So this is the breast pump and this is the nipple shade and supplementary system feed. Now customized feeding plan, the tailored feeding approach to meet the specific need of each infant. They are providing a different kind of the needs for to maintaining the growth and development of the preterm infant. They have specified the special calories, the zinc, the calcium requirement. Do you know? No. Taylor is the author. Actually, there is a neonatologist and pediatricians. Those are recommended a different kind of the calories, different kind of nutrition requirement for the preterm infant for the growth and development. They are defining a specific need apart from the full-term infant. Implement the intervention as a needed for the preterm infant support growth and development. So we have to do some implement intervention as per their requirement. Now the importance of the examination of full-term and preterm lactation. Why we are examining the full-term and preterm infant behavior? What is the need? Is there any need? What? Is there any benefit for the mother, for the baby? If you are assessing examination the full-term and preterm behavior, like we are assessing the poor sucking reflexes or good sucking reflexes, a good muscle tone, a poor muscle tone, is there any benefit for the mother and the baby?
Yes.
Yes? And why?
By assessing, we come to know what are the problems so that we can rectify.
Sorry.
By doing examinations, we come to know what are the problems so that can be rectified.
Yes. So we have to find out the nutrition need. The nutrition needs the full-term infant support the optimal growth and immune functions, right? Because the full-term infant already are maintaining their feeding process, right? And they're maintaining their feeding pattern. But yes, we have to provide the optimal support for their growth and development and to strong their immune system, prevention of any kind of disease condition, ensuring the adequate nutrition intake for developmental milestones. So we have to ensure the full-term infant are taking a proper amount of nutrition as per their demand, as well as we have to check the development of milestone by comparing their age. Now preterm infant. In the preterm infant, if we are doing the behavior assessment, address the unique nutritional requirement because each baby have their unique requirement. So we have to find out the unique requirement of the baby and support the weight gain and prevent the complications, right? Next is the milk composition difference. The milk composition, actually the full-term infant adaptive a change in the milk composition for the ghost drop. The ghost drop is a process where the baby having a rapidly growth within especially the infant period and after the 11 age of life. Okay, especially the infant period because the growth period is very rapid, so the demand also increase. The breast milk automatically will change and fulfill the demand of the infant. Okay. Now, in the preterm infant, the high level of the protein immune factor in a milk. So, if in preterm infant, they require a high level of the calorie, the calcium, the zinc, and this one protein for maintaining their growth and development. When you see the chart of the Taylor, they are defining each and everything, how we are maintaining the growth and development of the preterm baby based on the behavior assessment of the preterm. Now, maternal health and well-being. So, if we are assessing, then we can assess also the maternal well-being, like full-term infant, enhance the postpartum recovery and maternal health. In the preterm infant, reduce the maternal stress and promote the bonding. Like full-term infant, enhance the postpartum recovery. How the postpartum recovery will enhance through the proper breastfeeding, you know? How it will enhance? What is the postpartum recovery? after the delivery. Mother will revert with their pre-pregnant stage. There are so many changes that occur that time, right? So if the breastfeeding, if the mother are feed in a proper manner, if the mother are feed to the baby with a well-being, with a healthy, means mental or physical healthy, then they will be recovered early as well as reduce the stress of the mother, right? Okay, but in preterm infant, if you are assessing, we have to reduce the maternal stress by providing the support to find out the solutions, to provide the solution to the mother to enhance the feeding process, and provide the emotional support for the mother for the preterm infant. How to take care of the child, how to feed the child, what are the duration, how to maintain the frequency of feeding. Impact on the infant health outcome. The full-term infant reduce the risk of the common illness and infection, right? And the preterm infant decrease the risk of the serious conditions like the ROP and improve the mortality and morbidity outcome. So through the assessment, we have to reduce the infections and improve the mortality and morbidity outcome of the preterm, because early we have find out the problem, and early we have to sort out each and every problems. Now, infants of the long-term development. In the long-term development, full-term infant, positive effect of cognitive emotional development, and in preterm infant, improve the neurological outcome and the motor development. Individualized breastfeeding support. We have to support the tailored breastfeeding advice for the unique breastfeeding cues. So as I show you the hunger cues of the baby, so as per the cues, you have to find out the baby is hungry or not. Okay, so you have to initiate the demand feeding. Now the preterm infant, customized care strategies for specialized feeding need. Now, next is the policy and healthcare practices. So based on the assessment, we have to make some policies, right? The full-term infant, influence the healthcare policies to support the breastfeeding friendly environment. Is that true? By assessing their behavior, by assessing the breastfeeding process, can we develop some policies to support the breastfeeding friendly environment? Yes? Right? There, as the government are organizing different kind of the program to supporting the breastfeeding of the mother, so that especially in the India, you know, now according to 2022, the ratio of the exclusive breastfeeding is only 44%. Right? And if you are seeing the ratio of the preterm babies, that is the 3 million preterm babies are born in India only, and that is the ratio of the 20% of worldwide according to 2020. It is very higher, right? So we have to reduce this rate, right? Preterm infant, inform the hospital protocol and ICU practices. When we are finding out any problem, when we are doing the researches on these many, when we are assessing, doing the researches, then we have to find out the solution, change the policy of the hospitals, and changes the practice and enhance the practices of the NICU for the prevention of any kind of infection, and to enhance the practice of breastfeeding. Supporting maternal confidence. So by assessing, we have to enhance the confidence and empowerment of the breastfeeding ability of the mother, right? And preterm infant provide the evidence-based reassurance for the mother, because after the assessment, we have to conduct the research, we have to find out the solution, then we have to apply evidence-based practices for the enhancement of feeding process, right? So that's all about the importance of the assessment of full-term and preterm behavior of the lactations, right? So what is the conclusion? Can anyone please explain about the conclusion? What is the conclusion like? What is the importance? Lactation is a effective lactation is a key component of the infant and health, maternal well-being. It involves a combination of the proper breastfeeding practices, supporting environment, understanding the biological, emotional need both the mother and the infant, right? So through the breastfeeding process, we have to fulfill the demand of the mother as well as the baby. And by addressing the challenges, by leveraging the support system, mother can achieve a successful and rewarding breastfeeding experiences. Yes, so we have to initiate the examination of full-term and preterm behavior assessment. Okay. Thank you.
so much, ma'am. Now I would request you, ma'am, please kindly stay on the stage for your felicitation. I would like to invite Mr. Nitesh Sharma sir, nursing tutor, on the stage to felicitate Miss Priyanka Joshi, ma'am. Thank you so much, ma'am. Your perspective on the topic was thought-provoking and added a great value to our conference. Something as simple as better, breastfeeding could save 1 million children a year. It is a nature's health plan. Going ahead with the session, our next session is about issues related to early breastfeeding. And our speaker is Dr. Vandana Chauhan, Associate Professor, Swami Rama Himalayan University, Jolly Grant, BLS Instructor of American Heart Association. Before her session, let's watch a brief introductory clip about her experiences.
Dr. Vandana Chauhan, an esteemed Associate Professor of Child Health Nursing at Himalayan College of Nursing, Swami Rama Himalayan University, Dehradun, with a PhD in Child Health Nursing and 24 years of clinical and teaching experience. She has guided numerous research programs for PG and UG students and published 26 articles in national and international journals. Dr. Chauhan has been honored with the Best Teacher Award at SRHU in 2016 and a lifetime member of DNAI, Nursing Scholars Society and the Indian Association of Neonatal Nurses. She is also a BLS instructor certified by American Heart Association and has served as a peer reviewer for indexed journals. In addition to her academic responsibilities, Dr. Chauhan has been actively involved in community health initiatives, including working with Anganwadi workers and participating in health programs of children. She has organized and spoken at various conferences and workshops, and she currently serves as the academic coordinator for undergraduates, masters and NPCC programs. Please join us in welcoming Dr. Vandana Chauhan.
Very good afternoon to all. First of all, I would like to thank the Authority of Care of College of Nursing for a wonderful introductory video. Thank you so much. Since morning we are discussing about the breastfeeding, as we are celebrating the breastfeeding week, which is celebrated every year from 1st to 7th August. So since morning we have discussed global perspective, breastfeeding initiation, preterm and full-term breastfeeding differences. So let's see, there are some issues related to breastfeeding. Yes? There are some issues. It is well said by UNICEF that mother's milk is a nectar for the child, as mother's milk acts as a natural protective shield for the baby. Why? Because it provides the immunoglobulins to the baby, which boosts the immunity of child. So according to the American Academy of Pediatrics, breastfeeding has been recognized as the optimal source of nutrition for the baby, as it contains wholesome food for which is needed for the growth and development of baby. As per the WHO, as we are discussing since morning, exclusive breastfeeding has been recommended for the first 6 months of life, and it should be continued up to the 1 year or 2 years. So we will see a quick benefits for the breast milk. The benefits are for both baby and mother. So for baby, it provides the natural nutrients which is needed for the growth and development. Breast milk is easily digestible. We know that newborn has a very delicate GI system. So breastfeed is easily digestible, and as it reduces the chances of constipation. So it contains antibodies which boost the immunity of the baby, lower the risk of SIDS. I hope you are familiar with the word SIDS, S-I-D-S, that is sudden infant death syndrome, which has been seen in babies who are bottle fed. So the SIDS chances are reduced in the baby who breastfeed. The other, we can see the IQ level of the babies who breastfeed is much higher as compared to the other babies. And for mother, it helps to lose the weight after childbirth and reduce the risk of breast cancer and ovarian. Baby as well as for the mother. So they will learn both together, they will learn the skills for feeding. So in other side, there are some challenges which are faced by the baby as well as mother. So it is well said by Dr. Kaninika Mishra and Asta Alam that breastfeeding, while a natural essential practice, often comes with the challenges that require accurate knowledge and collective support to overcome. So in short, by providing adequate knowledge to the mothers, we can improve the breastfeeding practice among them. So there are some issues which mothers can face during breastfeeding: latching problem, sore nipples, engorgement, low milk supply, plucked milk duct, breastfeeding in public, health issues, and emotional and mental health. So one by one we will discussing these issues. So first is latching problem. Latching is what is latching? What is latching? We are discussing since morning. Latching. It is a attachment of baby to the mother's breast. Latching improves the sucking of milk. Poor latch can lead to inadequate milk supply for the baby and causes significant discomfort to the mother. If baby doesn't latch properly, baby will not get sufficient milk, as well as mother will feel problems. It might be painful for the mother. Like mother will have pain during feeding, sore nipples, and inadequate weight gain as baby doesn't get sufficient milk. So here you can see in the picture the proper latch. You can see the nose is free. Nose of baby should not be compressed with the breast. Lip of the baby mouth of baby. These are the sign of good latching that we should, as a nurse, we should explain to the mothers, so that she will take care of every time while she will feed the babies. So these latching can be enhanced with two feeding techniques, that is football and cradle hold. So these techniques should be told to the mother how to hold the baby in these two positions to getting a proper latch. Another problem mother can face a cesarean section, as Jyoti ma'am has already discussed. What happens in cesarean section? There is a time gap increase, separation time increase between the mother and baby. So what happened? It doesn't get the natural surge of oxytocin that can help with the milk supply. What can be done? What can be done with the cesarean mother? Alteration feeding position a mother can try, like sideline position or rugby hold position. And comfort devices she can use, like a pillow. She can put a pillow under the baby and feed the baby in a cradle hold position. Early skin contact can be maintained within the OT itself. While a baby delivered, within the OT, baby should be placed on the chest of the baby. It improves the secretion of oxytocin. And regularly mother should express the milk. If she will not comfortable to feed the baby, she should express the milk that can be given to the baby with spoon or calding. These are some techniques, position techniques, which a cesarean section mother can use to promote feeding. Another problem we have, sore nipples. The sore or cracked nipples are most common, particularly in the early days of breastfeeding. As I said that it is a new experience for the mother as well as baby. So this discomfort often results from an improper latch or friction during the feed. So what we can do, sore nipples can be rinsed with warm water or saline water and keep the breast dry, or otherwise there are various type of nipple creams available in the market. It should be used after the prescription only. Over the counter cream should not be used. Cold compression mother can use. We have to give cold compress, and it is a tradition to apply breast milk on the sore area. It will result in a early healing. And there are some hydrogen gel pads available in the market which can be applied, which improve the healing process of the cracked nipple. So if we see the contest, what wins? Breast milk application on the cracked nipple. Next problem a mother can face is the engorgement of breast. This is the most common condition among the mother. What is engorged breast? It is a swelling of both breasts, especially in the lower areas. Mother may feel pain or discomfort, and there will be firm and hard breast when we are touching or examining. So an increase in the amount of blood and lymph in breast causes breast engorgement. As we discussed that in first 2 days there will not be sufficient milk supply. The milk production start at 3 or 4 days after delivery. So then mother can feel the heaviness. Heaviness is different and engorgement is different. So how to manage the engorged breast? We should tell the mother to continue feeding should be continue. What happened while mother can't feed the baby continue, the breast will empty and it will prepare for another feeding. Cold compress we can provide to the mother. Well breast support, we can teach how to provide breast support, and we should tell to the mother remove extra milk before feeding the baby, because removing of extra milk will improve the latching. What happened that when breast is engorged, the baby will feel difficulty in latching. There will always tell the mother to remove the extra milk before feeding. We should advise the mother, do not empty the breast completely. We should not advise, and avoid massage. Another, this is the most common problem. Mother will say there is no milk in the breast, milk ही नहीं हो रहा है. This is the most common. So some mothers are initially produce a lower amount of milk, leading to concern about the baby getting enough nutrition. So the solutions are regular breastfeeding. As the baby sucks the breast, oxytocin and prolactin will improve the milk production. जितना बेबी सक करेगा उतना मिल्क प्रोडक्शन होता है. This is a continuous phenomena. And stay hydrated. Mother should be well hydrated. If needed, she can take the lactation supplements if needed, but with prescription only. Another condition, if a baby is sick, then the sick baby cannot take the breastfeed, or baby is admitted in the NICU, baby is separated from the mother. Health issues of baby may be preterm or low birth weight baby, jaundice, congenital anomalies, and there are many more health issues where the baby is not with her mother. So what we will tell to the mother need to express milk manually. It will prevent engorgement and it will maintain the milk supply. Then when she will receive the baby, she can continue the feed. Nursing strike. What it means? Nursing strike. Strike means? Strike is a common word, na? What is the meaning of strike? हिंदी में हड़ताल है ना, हम नहीं करेंगे. तो बेबी भी ऐसे ही करता है कभी कभी. So when baby suddenly begins to refuse the breast milk, होता है? Ever happen? Suddenly it will refuse the accepting breast milk. The nursing strike indicates some issues with the baby. You should tell to the mother that if baby behaves like this, you should investigate the baby. What can be the cause? So causes, am I audible? Causes can be ear infection, causes of nursing strikes can be the ear infection, which is most common in a breastfed baby. If adequate posture is not maintained during feeding, cold or stuffing nose, as the newborns are nose breathers only, they don't know how to breathe through mouth. So if the nose will be nose of baby will be blocked, that baby will not be able to suck the milk. Distraction. We have seen that if mother is feeding the baby in a crowded place, the baby gets distracted and he or she will refuse feeding. And overuse of pacifier, as we discussed that if we put baby on the bottle feed, it is easy to suck from the bottle and it will discourage breastfeeding. Like breastfeeding में ज़्यादा मेहनत लगती है बच्चे को, बॉटल फीड से इजी होता है बच्चे को दूध पीना. तो पेसिफायर अगर हम यूज कर रहे हैं तो वो भी बच्चा इंटरेस्टेड नहीं होगा दोबारा ब्रेस्ट फीड लेने के लिए. So what can mother do? Mother can express the milk manually, observe urine output to check whether baby is getting sufficient milk or not, change feeding technique or position. We can tell the mother try another feeding position, and always try to tell the mother that while she is feeding the baby, environment should be calm and comfortable for both mother and baby. So inverted and flat nipple, this is another issue which should be treated in a antenatal period only. पोस्टनेटल में हम इसको एंटरटेन ज्यादा नहीं करते, बट एंटीनेटल में itself ये ट्रीट होना चाहिए. So what happened with inverted or flat nipples? There will be again a latching issues, difficulty in feeding, and baby will not gain sufficient milk. So what can be done? So before feeding, nursing shields are available in the market. Mother can use that shields. Hand expression, milk can be expressed by palm or hand. During feeding, V and C hold technique improve the latching. So you can see in the picture V and C holding of the breast, and then after feeding track wet diaper to check whether baby is getting enough feed or not. Mastitis, another problem. Mastitis is inflammation of breast. So it is a very painful condition for the mother. Symptoms are pain and discomfort, tender and swollen breast, fever. Mother may feel lump in the breast, discharge from the nipple and cracked nipple. So what can be done for mastitis? Encourage the mother continue to feed the baby on demand. Cold compress can be advised. On prescription, if brufen and paracetamol can be given to reduce the swelling and pain. Gentle massage can be prescribed for the mother, and mother should be encouraged for manual expression of the milk. Proper breast support mother should get, and prebiotics. Prebiotics are the green vegetables, milk, curd. These improve the GI system and this boost up the immunity and prevent the infection within the breast. Plugged and clogged ducts. It happens when the milk duct doesn't drain properly. Pressure then build up behind the plug. As you can see the picture, duct is clogged. जो मिल्क है वो वहीं पे जमा रह जाएगा, वो हार्ड हो जाता है, देन वो मिल्क सप्लाई उस डक्ट से प्रॉपर्ली नहीं हो पाती है. So what can be done? Breastfeeding on the side with a plugged duct are often as every 2 hours. Offer as every 2 hours. It will help loosen the plug and keep the milk moving freely. A baby's chin should be at the plug. It helps to dislodge that plug. Massage in a circular motion at the affected area. We should use warm compress on the sore area. Dry heat should be avoided. Warm compress should be advisable. Adequate rest induce healing and proper breast support. Another emotional problem, a mother may have fatigue and stress. It usually happens with the new mothers. So new mothers may feel overwhelmed by demands of frequent breastfeeding leading to fatigue and stress. The solution may be family support, friend support and lactation consultants mother can select, and ensuring adequate rest and nutrition, which is very much important for baby mother. Tongue tie. Have you seen this? Tongue tie. When the baby's tongue is not freely movable. So a condition where the tissue connecting the tongue to the floor of the mouth is shortened than usual, which can be interfere with breastfeed. When maybe pediatric में आपने पढ़ा होगा tongue tie. Tongue जो है वो नीचे से चिपकी होती है, freely move नहीं करती. तो जब टंग टाई होगा तो बेबी सक नहीं कर पाएगा मिल्क. तो इसका एक ही सॉल्यूशन है, रिलीज ऑफ टंग टाई, विच इज डन बाय अ पीडियाट्रिक सर्जन. देयर आर सम कल्चरल ट्रेंड्स टू अवॉइड कोलेस्ट्रॉम, एज इट इज सेड इट इज नॉट गुड फॉर द बेबी, and it has been seen that some people are giving tea and grape water to maintain the GI system. Like it is said that good tea will improve the digestion of the baby. Have you heard good tea and this? Yes. So, having a abdominal colic is a normal for baby. So, it doesn't need any good tea and any grape water. So, feeding baby any liquid or food other than the breast milk before 6 months actually increase the chances of newborn to getting sick. So we should not entertain or we should not encourage the mother to give any pre-lacteal supplements. Pre-lacteal supplements are these only: good tea, honey, somewhere honeys are also given, good tea, grape water, bottle feed. These all are pre-lecture feeds. Is it okay to feed in public? Very good, yes. I hope you have seen this earlier. In the news it was there. Alia Joy Walter made political history in Australia by becoming the first baby to be breastfed in Australian Parliament. So there is no shame to feed the baby in a public. So there is absolutely no shame. A mother can feed the baby anywhere, anytime. If mother prefer, can use a lightweight blanket as cover. The law says mother can breastfeed in public anywhere you are allowed to be, including restaurant, park, anywhere. So we are talking about the exclusive breastfeeding till 6 months. It is recommended by WHO. Now what about the working women? Not every institution is giving 6-month maternity leave. Yes. So what can be the solution? Our Indian government has developed a Maternity Benefit Act. It requires employer to provide maternity leave for 6 months. It is compulsory, but still it is not followed. Nursing breaks of prescribed duration for new mothers in order express breast milk for nursing child. These nursing breaks are fully paid and are available until a child reach at the age of 15 months. So Ministry of Women and Child Development, Government of India has issued a crutch guideline in November 2018. In line with the guideline, following are the salient features: 1 crutch for every 30 children between the age 6 months to 6 years of all type of employee. Then the crutch must be located at the workplace within 500 meters of the establishment. An employer are required to employ 1 crutch worker along with a helper for every 10 children under the age of 3 years and for every 20 between the age of 3 to 6 years. And I am very proud and happy to tell that our institute has crutch. So what a working mother can do, there are facility for storage human milk. So human milk can be stored at room temperature for 6 to 8 hours. The working woman can express the milk and keep it in freezer for feeding their child whole day. In insulated cooler bag with ice packs for 20 hours, it can be kept in refrigerator for about 5 days at 40° Fahrenheit. In a freezer compartment of fridge up to 2 weeks at 0 to 5° Fahrenheit, and in a deep freezer about 3 to 12 months. These are the guidelines provided by Government of India. So these were the issues. Then how to overcome that issues? There are some general tips for mothers for breastfeeding. So like to establish a good breastfeeding routine, frequency should be on demand or at least 8 to 10 per day to establish a plentiful milk supply. Position, regarding position, experiment with hold like cradle, cross cradle and football hold to hold fine that works. A mother can choose any position in which she feels comfortable. A mother should keep patience during feeding. Breastfeeding takes an practice for both mother and baby to get the hang of it. Skin to skin contact is very much important as it improves the secretion of oxytocin. It enhances secretion of milk. It helpful in bonding. Like skin to skin contact promotes emotional attachment between the mother and baby. It will helpful to maintain the temperature of the baby as baby will be connected to the mother, and it will keep the baby's blood sugar at normal pace. Why? Because the baby will have opportunity to feed anytime. Now there are some lactation supports also for breastfeeding education. problem solving and emotional support. They will help the mother in promoting breastfeeding. So, while I was searching the content, I came across the studies. It was done in Spain regarding breastfeeding difficulties and risk for early breastfeeding cessation. And the result, the problem faced by the mother were cracked nipple, insufficient milk supply, pain, fatigue, mastitis, and working women were not able to continue the exclusive breastfeeding. Another study done in Maharashtra to assess the prevalence and determinants of early initiation, exclusive breastfeeding and pre-lactal feeding among children aged between 0 to 24 years. And the result was the risk factors which the study can find out that a cesarean delivery mother was not initiate breastfeeding as early as possible. Pre-lactal feeding they have given, and most of the babies were low birth weight babies, so early feeding was not started. So to conclude my topic, yes, a mother or baby feel some issues during feeding, but they can be prevented and they can be managed with proper management. These are the references. Thank you for the listening.
Thank you so much, ma'am. Kindly stay on the stage for a felicitation, ma'am. I would like to invite Mrs. Preetika Sharma, ma'am, kindly come upon the stage for the felicitation. Thank you so much, ma'am. Thank you so much for such a thought-provoking session. Breastfeeding is a mother's gift to herself, her baby, and the earth. So our next session is breastfeeding infants with cardiorespiratory disorders. Now I would like to invite Ms. Neha Sharma, Assistant Professor at Care College of Nursing and PhD Scholar. Before she is starting her session, let's watch a brief introductory clip about her.
Ms. Neha Sharma is a dedicated nursing professional with a rich academic and clinical background. Born in Kanpur, Uttar Pradesh, she completed her BSc at K.S. Sastry Smarak Nursing College in Lucknow. She has gained valuable clinical experience, having worked for 8 months at SPM Hospital in Kanpur and has been involved in teaching at Care College. Ms. Sharma furthered her education with an MSc in Critical Care Nursing from Himalayan College of Nursing, Joligram, Dehradun from 2018 to 2020. She has published one national and one international article contributing to the body of knowledge in her field. Her professional experience include roles as program coordinator for A&M and GNM and as an admission counselor at Care College Nursing, Haridwar. She has actively participated in 3 national and 2 international conferences and has organized one webinar and a state level workshop on critical care advanced nursing. In addition to that, she facilitated a 2-day training program on hepatitis update at ILBS. Please join me in welcoming Ms. Neha Sharma ma'am.
Very good afternoon to everyone present over here. Respected Director Ma'am, Additional Director Ma'am, all the dignitaries, all the faculties and all the delegates. So as they already introduced me, so and I'm having only half an hour to complete my topic. So just to start my topic. Okay. So my topic is breastfeeding infant with cardiorespiratory conditions. Okay, so till morning हम लोग डिस्कस कर रहे हैं ब्रेस्ट फीडिंग क्या है, ब्रेस्ट फीडिंग को कब इनिशिएट करना चाहिए, क्या क्या उसके बेनिफिट्स होते हैं. बट देयर आर सम इलनेस कंडीशंस, देयर आर सम हेल्थ इश्यूज विद बेबी. जब बेबी को हमें फीड कराने में प्रॉब्लम होती है, ठीक है. नॉर्मल बेबी को कैसे फीड कराना है, क्या क्या पोजीशंस होती है, वी ऑलरेडी नो. ओके, बट अगर बेबी के साथ कोई इलनेस कंडीशन है, कोई हेल्थ इश्यू है, कोई कार्डियक कंडीशन है, सकिंग रिफ्लेक्सेस प्रॉब्लम है, ठीक है, पुअर मसल्स जो टोन है, अगर वो बेबी की वीक है, एज प्रियंका मैम ऑलरेडी टोल्ड, तो उसके साथ साथ हम लोगों को क्या क्या करना चाहिए, वी विल कवर इट विद दिस टॉपिक. सो फर्स्ट वी विल गो विद द इंट्रोडक्शन. The American Academy of Pediatrics recommends 6 months of exclusive breastfeeding and continuation breastfeeding until infant is become 1 year old. Okay, so while gradually introducing solid food after the 6 months. A well said probe is there. The work of breastfeeding is actually less than the work of bottle feeding. For that, the amount of oxygen available to your baby is greater while breastfeeding than bottle feeding. Okay, so इस कोर्स से भी हमें ये चीज क्लियर हो जाती है कि बेबी फीडिंग जो है, ये जो हमारा ब्रेस्ट फीडिंग है, ये कहीं ना कहीं हमारी बॉडी के अंदर जो ऑक्सीजन लेवल है उसको भी मेंटेन करता है. ठीक है, एज माय टॉपिक इज बेबी को क्या है, कार्डियो रेस्पिरेटरी कंडीशंस है. तो अगर हम बेबी को प्रॉपर ब्रेस्ट फीडिंग कराते हैं, ठीक है, तो उसमें क्या है, बेबी की बॉडी के अंदर जो ऑक्सीजनेशन लेवल है वो ऑलरेडी मेंटेन रहेगा. So, the term cardiopulmonary disease describe a range of conditions that affects the heart and the lungs too. So, here are some examples. The cardiorespiratory disorders encompasses a range of conditions that affect the both heart and the respiratory conditions. ठीक है, respiratory system और जो हमारा cardiovascular system है, इन दोनों के जो combination issues होते हैं, उसको हम क्या बोलते हैं, cardiorespiratory disorders. So here's some example are there, like congenital heart defect. Congenital heart defect is nothing but it is the structural abnormality in the heart present from the birth. For example, जैसे इसके साथ आपके सब टाइप्स हैं, जैसे आपका आता है इसमें tetralogy of Fallot and transposition of the major arteries. ठीक है, तो tetralogy of Fallot में क्या होता है, anyone knows? Tetralogy of Fallot and transposition of the great arteries. Okay, so tetralogy of Fallot is nothing but इसमें क्या होता है, जो हमारे हार्ट के इसमें जो कॉम्बिनेशन ऑफ 4 हार्ट डिफेक्ट्स आर देयर, जो कि क्या करते हैं, जो हमारी ब्लड फ्लो है उसको अफेक्ट करते हैं. सेकेंड वन इज जो ट्रांसपोजिशन ऑफ ग्रेट आर्टरीज. सो एज वी नो कि जो हमारी आर्टरीज हैं, ठीक है, हार्ट और लंग का जो ये कॉम्बिनेशन है, क्योंकि ये एक साथ ही वर्क करते हैं, ऑक्सीजन और ब्लड एक साथ काम करते हैं. ठीक है, तो इसमें क्या होगा, इट इज अ कंडीशन वेयर द मेन आर्टरीज ऑफ द हार्ट गेटिंग स्विच्ड टुगेदर. ओके, along with that there are some other conditions are there, like congestive heart failure is there, then pulmonary hypertension, respiratory syncytial virus infection is there. Severe viral infection that can cause a significant respiratory distress in infant. Basically, potentially we can say that impacting their overall cardiovascular health. Then asthma. Asthma का नाम सभी ने सुना होगा. It is a very common condition between infants and all adults के साथ भी. Then bronchopulmonary dysplasia condition. So these are the several conditions which comes under the cardiorespiratory disorders. I hope यहाँ तक क्लियर है सबको. लंच का टाइम हो रहा है. I understood. So as the illness is there, so there may be some challenges are. So several challenges we are going to discuss in this slide. Breastfeeding with cardiorespiratory disorder can present several challenges like feeding difficulties. So basically infant with cardiorespiratory issue might have difficulty for latching or sucking the nipples effectively due to the fatigue or some breathing issues. Then second one is your breathing and feeding coordination. So for that, coordinating breathing and feeding can be challenging if the infant is having any compromised respiratory condition. Then next one is your fatigue. So if these infant may be tired quickly. Okay, so if the infant is having any kind of respiratory or cardiovascular issue, these infants can getting tired easily. Then these disorder can vary, we can say like greatly in their severity and the specific disorder conditions. Then last one is your specialized nutritional needs. Sorry for the interruption. So these are some several challenges we are mother with facing with the infant is if baby is having any kind of cardiorespiratory condition. So just because we are discussing about the breastfeeding, so there are lots of benefits of breastfeeding with the cardiorespiratory condition. So breastfeeding can have several benefits for the infant, जो कि क्या करते हैं cardiorespiratory conditions में help करेंगे. So first of all, nutritional support. So ये मॉर्निंग से हम लोग को ये चीजें पता चलती जा रही है कि ब्रेस्ट फीडिंग जो है वो बेबी की न्यूट्रिशनल स्टेटस को भी मेंटेन रखता है. So basically, breast milk provide essential nutrients that support overall health and can be easier to digest for infant with respiratory issues compared for the formula. So as we know, a proper nutrition or hydration can help to protect the baby from the infection. Second one is your immune system boost. Okay, so breastfeeding में जब breastfeeding कराते हैं जो हमारा breast milk होता है उसमें कौन कौन से nutrients होते हैं सभी को पता है. अभी हम लोग previous lectures में भी discuss कर रहे थे. वो nutrients क्या करते हैं बेबी के immunity system को भी maintain करके रखते हैं, as well as mother के लिए भी वो बहुत ज्यादा beneficial होते हैं. So for that, as we know, weak immune system babies are having some more chances to get sick easily as compared to normal baby. So जो breast feed है या जो हमारा breast milk है वो क्या करेगा बेबी को sick होने से protect करता है. Along with that reduce risk of the allergy, क्योंकि बेबी का क्या है immune system भी maintain रह रहा है. So उसके साथ क्या होगा जो उसका allergy के chances है वो भी क्या हो जाएंगे reduce हो जाएंगे. Okay. Then optimal growth and development. Breastfeeding supports healthy growth and development, which can be particularly important for the children with chronic health conditions. Okay, so my next slide is going to be discuss about this some management technique. So breastfeeding an infant with cardiorespiratory conditions can be challenging. But we can say often there are some managerial techniques are there. Okay, so here's the जैसे हमारी जो theme है वो क्या है closing the gap. Okay, so here's closing the gap is breastfeeding for infant with the cardiorespiratory disorders. involves multifaceted approaches to address the unique challenges. Okay, unique challenges and these conditions present here. So here some managing techniques are there, like personalized feeding plans to develop in individualized feeding plans to consultation with healthcare providers, including pediatrician and lactation consultant. These plans should address the specific needs for the baby to related to the infant's cardiac or respiratory conditions. Okay, so in that we will discuss one by one. First one is your medical guidance. Medical guidance is nothing but it is about the consult with the healthcare provider or consult with the infant's healthcare team to understand the we can say specific need or restriction which are related to that particular condition. Okay, then along with that they can offer advice or positioning feeding जो feeding के लिए proper positioning होंगे. So second is your feeding position. Feeding के लिए बच्चे के लिए proper positions होनी चाहिए. As अभी जो हमारा previous session था उसमें वंदना मैम ने भी बताया, प्रियंका मैम ने भी बताया था. कौन-कौन सी positions हैं? Can anyone tell? मतलब सेशन अच्छा गया है. Okay. So then along with that third one is your feeding frequency and duration. Actually में होता क्या है, जब अगर बेबी को कार्डियो रेस्पिरेटरी कंडीशन है या कोई भी इलनेस कंडीशन है तो बेबी प्रीवियसली भी हमने डिस्कस किया बहुत ज्यादा थक जाता है, क्योंकि क्या हो रहा है वो पुअर सकिंग रिफ्लेक्सेस है, उसकी वजह से वो प्रॉपर फीड नहीं कर पा रहा है. वो ड्यूरेशन को कोशिश करता है, बेबी बहुत ज्यादा ट्राई करता है टू गेट प्रॉपर मिल्क बट वो उसको नहीं मिल पाता है. ठीक है, तो उसके लिए क्या करना होता है, मदर को फीडिंग जो है उसके लिए एक प्लान बनाना होता है, एक ड्यूरेशन सेट करनी होती है. यूजुअली क्या होता है कि जब बेबी को नीड होता है हमें तब उसको फीड कराना होता है, यूजुअली यही होता है. बट यहाँ पर हम क्या करेंगे, बेबी के लिए एक शेड्यूल प्लान कर देंगे, लाइक हमें हर 1 आवर में क्या करना है, बेबी को फीड कराना है. क्योंकि क्या हो रहा है कि बेबी जो जिस तरह से उसको फीड करना चाहिए, जितना अमाउंट ऑफ मिल्क उसको मिलना चाहिए वो प्रॉपर मिल नहीं पा रहा है. तो उसके लिए हम क्या करेंगे, प्रॉपर शेड्यूल बनाएंगे और उसके अकॉर्डिंग ही छोटे छोटे ड्यूरेशन में थोड़ा थोड़ा अमाउंट ऑफ मिल्क बेबी तक पहुंच जाएगा. देन मॉनिटरिंग. सो ऑब्वियसली बेबी को हम क्या फीड दे रहे हैं, बेबी को फीड जो हमने दी है वो किस तरह से हेल्पफुल रहा उसके लिए या नहीं रहा, या कोई फर्दर कॉम्प्लिकेशन तो नहीं आ रहा है, कोई एस्पिरेशन के चांसेस तो नहीं है वहां पर. ये सारी ओवरऑल चीजें ऐसी हैं जो हम लोग को प्रॉपर स्ट्रिक्टली मॉनिटरिंग करनी होती है. देन सपोर्टिव इक्विपमेंट्स. सो इफ मदर इज हैविंग एनी काइंड ऑफ इश्यू टू फीड द बेबी, लाइक ब्रेस्ट इन्वॉल्वमेंट है, क्रैकल निपल्स हो रहे हैं, मदर अगर फीड नहीं करा पा रही है बेबी को, तो उसके लिए हम क्या कर सकते हैं, कुछ सपोर्टिव इक्विपमेंट्स का यूज कर सकते हैं. पंपिंग मशीन्स आती हैं, अभी हमने डिस्कस भी किया था, देखा था प्रीवियस स्लाइड्स में भी. ठीक है, कुछ अदर आपके आर्टिफिशियल टेक्निक्स आती हैं. ठीक है, फॉर्मूला मिल्क्स भी आते हैं. अगर बहुत ज्यादा नीड है तब हमें बच्चे को वो देना है. अनटिल अनलेस अगर मदर कैपेबल है या बेबी कैपेबल है कि आप उसको फीड करा सकते हो, तो आपको क्या करना है, 100% कोशिश यही करनी है कि आप बेबी को ब्रेस्ट मिल्क दो. ठीक है, आप उसको फीड करवाओ. बट इन दैट केस अगर बेबी को बहुत ज्यादा प्रॉब्लम हो रही है तो आप वहां पर फॉर्मूला मिल्क यूज कर सकते हो. बट कोशिश क्या करना है, सपोर्टिव इक्विपमेंट्स को यूज करना है, जैसे जो पंप्स आते हैं. ठीक है, पंप्स के थ्रू भी हम क्या कर सकते हैं, बेबी को इजीली फीड करा सकते हैं. देन न्यूट्रिशनल नीड्स. ऑब्वियसली बेबी की जो न्यूट्रिशनल नीड्स है उनको भी हमको क्या करना है, मेंटेन करके रखना है, ताकि जो बेबी का इम्यूनिटी सिस्टम है वो मेंटेन रहे. सो हियर्स द कंक्लूजन. The breastfeeding an infant with a cardiorespiratory disorder can be highly beneficial provided specific considerations are addressed. Breast milk offers optimal nutrition, supports immune function and can be easier to digest than formula. मतलब क्या है, जो formula milk है उसके comparative क्या है, जो हमारा breast milk है वो easily baby के लिए digestible होता है, baby easily उसको digest कर सकता है. Then which is crucial for the infant with complex health needs. However, the feeding process might need to be adjusted based on the severity of the disorder and the infant's ability to feed effectively. Coordination with the healthcare professionals essential to monitor the infant's growth and adapt feeding strategies as needed. Overall, breast breastfeeding can contribute positively to the infant's health and its development, but it's really required to careful management to ensure both for the infants and mother's need are the best. Okay, so thank you so much. I hope you understand my topic.
Thank you so much, ma'am. Now I would like to invite Ms. Priyanka Joshi ma'am. Please come up on the stage to felicitate Ms. Neha Sharma ma'am. Thank you so much, ma'am. We had such a great session and got to know about a lot of information. So moving ahead to our section, our next session is about medication and lactation. And the next session speaker is Ms. Rupinder Deol, Associate Professor, College of Nursing, AIMS, Rishikesh, PhD Scholar, American Heart Association Certified BLS, ATCN Instructor and ACLS, PALS Provider, will brief about medication and lactation. Before the session, let's watch a brief introductory clip about her experiences.
Esteemed Associate Professor at College of Nursing, AIMS, Rishikesh. Dr. Deol is currently a PhD Scholar with the INC Consortium and holds a Master degree in Pediatric Nursing from CMC Vellore and a Bachelor's degree in Nursing from CMC Ludhiana. She has further specialized through Advanced Pediatric Cardiology program at the University of Toronto. Over 16 years of professional teaching experience, Dr. Deol is a certified instructor in various American Heart Association courses, including BLS, ACLS, ATCN, and PALS. She has served as National Faculty for Neonatal Resuscitation Program by the National Neonatology Forum of India. Dr. Deol's dedication to pediatric care is evident through her observership at Sick Kids Hospital in Toronto and multiple certifications in palliative care, quality improvement, and advanced nursing leadership. Her commitment to education is reflected in her role as a research guide and external examiner for nursing students across various prestigious institutions. Beyond her teaching and clinical expertise, Dr. Deol has published over 25 papers in national and international journals and contributed chapters to several books. At AIMS Rishikesh, she has held several significant administrative roles, including Assistant Dean of Students' Welfare and Nursing Superintendent. Dr. Deol is a member of numerous professional organizations, both nationally and internationally, and actively participates in various committees and initiatives aimed at enhancing healthcare quality and education. Please join us in welcoming Dr. Rupinder Deol as she shares her invaluable insights and experience.
good afternoon to respected dignitaries, resource persons, the organizers, and dear delegates. So this is a session just before I know you are waiting for your lunch, and I'll try to speed it up, but I'll try to take the important points also out of it. I will be discussing about medications and lactation. So we have been talking about breastfeeding, its importance, and all these points since morning. And breastfeeding is universally recognized as the preferred method of infant feeding and is associated with decreased infant mortality. By now we know this, right? But it is sometimes abbreviated because of the fear of harm to the infant from the maternal medications. Despite this, physicians as well as nurses, they often receive little education on supporting breastfeeding. Comprehensive assessment can prevent unnecessary avoidance of breastfeeding, premature discontinuation of breastfeeding, or suboptimal treatment of the mother's condition. This session will be providing you information on the management of medications for common conditions during the lactation. So often there is a need to decide whether a mother who is breastfeeding and who needs treatment with drugs can take the necessary medication and can still continue to breastfeed safely. There are very few kinds of treatment during which breastfeeding is absolutely contraindicated. However, there are some drugs which a mother may need to take, which sometimes can cause side effects in the baby. So if we talk about the classification of drugs for the breastfeeding, that is the drugs which are given to the mother, right? For any condition, we classify them either the drug may be compatible with breastfeeding. The drug is classified as compatible with breastfeeding if there are no known or theoretical contraindications for its use, and it is considered safe for the mother to take the drug and to continue the breastfeed. Then we say the drug is compatible with breastfeeding. But few of the drugs, they may be compatible with breastfeeding but are classified as monitor the infant for side effects along with it. So these drugs are classified in this way if they could theoretically cause side effects in the infant but have either not been observed to do so or have only occasionally caused some mild side effects in the babies when the mother is receiving these drugs. So for these we need to inform the mother about any possible side effects, reassure her that they are unusual and ask her to return if they occur or if she is worried. If the side effects do occur, stop giving the drug to the mother, and if necessary we need to find an alternative to that drug. And if the mother cannot stop taking that drug, she may need to stop breastfeeding and feed her baby artificially until her treatment is completed. Help her to express her breast milk to keep up the supply so that she can breastfeed again after she stops taking the drug. The third category is avoid if possible and monitor the infant for side effects. These drugs are classified in this way if they have been reported to cause side effects in the infant, especially if the side effects could be serious. So these drugs should be used only when they are really essential for the mother's treatment and when no safer alternatives are available. And we should allow the mother to continue breastfeeding but give her clear instructions about observing the baby and arrange for the frequent follow-ups of the mother as well as the baby. And if the side effects occur, the drug should be stopped immediately. If it is not possible to stop giving the drug, stop breastfeeding and feed the baby artificially until the treatment is completed. Help the mother to express her breast milk to keep up the supply so that she can breastfeed again after she stops taking the drug. The fourth category is we need to avoid that drug if possible because it may and these drugs may inhibit the lactation. So these drugs are classified in this way because these may reduce the breast milk production and if possible they should be avoided. However, if mother has to take one of these drugs for a short period, she does not need to give the artificial milk to her baby. She can offset the possible decrease in milk production by encouraging her baby to suckle more frequently on her breast, as we have already discussed about the different reflexes and how suckling helps in more milk production. Then the fifth category is avoiding certain drugs. These are classified because they may have dangerous side effects on the baby, and they should not be given to the mother while she is breastfeeding the baby. If they are essential for treating the mother, she should stop breastfeeding until the treatment is completed. If the treatment is prolonged, she may need to stop breastfeeding altogether, and there are very few drugs in this category apart from anti-cancer drugs and radioactive substances. So talking about the transfer of these medications into the breast milk, why we are categorizing these drugs into different categories? Because we know that when mother is taking a drug, that may possibly be transferred to the infant or to the newborn baby through the breast milk. So medications, they enter the breast milk through diffusion from the serum. So milk concentrations depend on the maternal serum drug concentrations and also their diffusing characteristics. Few medications, they are actively transported into the breast milk, and medications, they generally diffuse out of breast milk as the concentration in the plasma, maternal plasma, diminishes. Unlike the placental transport in pregnancy, medical absorption in breastfeeding is via the infant's GI tract. So we should remember that when the mother is pregnant and is taking any drug, that is directly transferred to, may be transferred through the placenta to the newborn, right, to the fetus. But in case when the mother is breastfeeding and is taking some medication, that medication will have effect on the infant only when it reaches through the breast milk up to the infant's gut and gets absorbed there. Okay, so the drugs which are absorbed in the GI tract of the babies and how much it, in how much amount it is reaching up to the GI tract of the newborn, that will determine the effect of that drug on the infant or on the newborn baby. The amount of medication that enters the infant through breast milk is determined by the medication concentration in the milk, the volume consumed by the baby, and the GI absorption of that drug. In the early postpartum period, large gaps between the mammary alveolar cells allow the medication to enter the milk more readily. And this effect is mitigated by small volume of colostrum consumed. So during the first 2 days or a few hours, the baby is taking only a small amount of colostrum. So the effect of these drugs or the absorption may be mitigated because a very small amount is being taken by the baby. Okay. And topical medications, they are generally safer than the oral medications. All the medications which are applied directly to the nipple may be concerning. Okay. And the infant's health can alter the effect of exposure to the maternal medication also. So if the infant or the baby is a healthy baby, they may be able to tolerate the same amount of medication as compared to the babies who are sicker. A smaller exposure may be significant in an infant with the less ability to metabolize medications, and the same medication exposure may be less problematic in an older healthy infant who is merely weaned. Okay, so the effects of the same medication being taken by the mother will be different in a preterm baby and a term baby, sick baby and a healthy baby. Some additional considerations which we can keep in mind or we need to know is that the safety of certain drugs also depends on the age of the infant. Premature babies and infants who are less than 1 month of age, they have a different capacity to absorb and excrete drugs than the older infants. Thus, in general, extra caution is needed for the smaller babies. Unless the drug falls into a category with clear contraindications, for example, the cytotoxic drugs, advise the mother to continue breastfeeding and ask her to come back if she notices anything worrying about her infant. So for minimizing the potential risk to breastfeeding infants from the medications, there are certain points, general considerations which we can keep in mind, like we should avoid drug therapy whenever possible. Medications that are safe for use in an infant are generally safe for the breastfeeding mothers also. Okay, some medications which we are administering to the newborn babies, if mother is taking similar medications, they may be safer. Medications that are safe in pregnancy are not always safe while breastfeeding. We should not assume that this medication is being taken by a pregnant woman and so it will be safer for a lactating woman also. Use reliable references for obtaining information on medications in breast milk, and use topical therapy whenever possible except directly on the nipples of the mother. For selecting the medications, choose the medications that are well studied in the infants, because there are a lot of medications in the market and the effects of many of those have not been studied on the newborn babies and on the infants. Choose medications with the lowest lipid solubility, poorest oral absorption, with a shorter half-life and highest protein binding abilities. And regarding the dosing of the medications, single daily dose medications are preferred just before the longest sleep interval for the infant, usually after the bedtime feeding. Okay, so we should try to give medications which are having in a single dose, and maybe during the night time if mother can take it after giving a feed to the baby, after breastfeeding the baby. Okay, because there will be a longer gap between the next feed. Breastfeed the infant immediately before the medication dose when multiple daily doses are needed. And when mother is taking multiple doses, she should try to feed the baby before taking the medication to reduce the amount of medication which is being transferred through the breast milk to the baby. There are certain resources, as I told, that proper review should be done about the drugs, and we should know which drug is affecting the infants in what way. So for that, as medical personnel and nursing personnel, we have certain resources like LabMed is a very important resource which is having in detail most of the drugs which have been tested on the infants, and whenever we are administering or advising some kind of drug to the lactating mother, we can always go through this resource and we can read about its effect on the infant and how much of this drug will be transferred to the newborn baby through the breast. Okay, and Lactatia is another resource, and Medication and Mother's Milk is a textbook which also has good references related to this. For the mothers, we can recommend them going through drugs.com, mother2baby.org, or Trash the Pump and Dump, and MommyMeds app is there which may guide them at certain points. Moving on to the medications which the mothers may require in different conditions. So first is the conditions related to behavioral health. Behavioral health concerns are very common during pregnancy and lactation, and effectively treating the mother is the highest priority, because this will allow for the most effective parenting and bonding between the mother and the newborn. So some mothers they may need to be treated for depression, and the preferred approach for treating depression during lactation is to continue any treatment that was effective during the pregnancy also. Selective serotonin reuptake inhibitors, they are generally safe during breastfeeding. The most preferred are sertraline and paroxetine, which is generally not used in pregnancy because it can cause teratogenicity in the first trimester. But these are best studied and they have low infant exposure and fewer side effects, so they can be given to the lactating mothers. Fluoxetine and its active metabolite have a long half-life and it should be avoided if possible. And if fluoxetine is effective for a particular mother, observe the infant for the signs of irritability. Serotonin, norepinephrine reuptake inhibitors are less preferred because of the limited data which is available, but they are generally compatible with the breastfeeding. For anxiety, antidepressant medications are commonly used to treat anxiety, but acute anxiety may be treated with benzodiazepines also in the lactating mothers. And the benzodiazepine use may really result in sedation of the breastfeeding infant, which must be weighed against the benefit of treating the anxiety in the mother. And sedation of benzodiazepine exposed infants is quite rare, and it is associated with taking other psychoactive medications along with benzodiazepines if mother is taking like opiates or antipsychotics or antidepressants. Then the child may be seen as sedated child or may not take the feed properly then. With its short half-life span, lorazepam is a safer benzodiazepine during lactation. Clonazepam is more likely to cause infant sedation because it may accumulate in the infant because of its longer half-life. So clonazepam should be given with caution. Lorazepam is a more safer drug to be given in anxiety. ADHD, attention deficit hyperactivity disorder, data is limited related to it, but methylphenidate appears to be the safest option, and it is found in low levels in the breast milk and not in the infant serum. It is associated with decreased prolactin levels and raises a concern for decreased milk supply. So this drug may cause decrease in the milk supply in the mother. Okay, so that needs to be addressed. And amphetamines may decrease the serum prolactin and are found in higher levels in the breast milk and infant serum. Clonidine should be used with caution because it passes readily into the breast milk, and atomoxetine is not well studied, and safer alternatives should be preferred. For the opioid replacement therapy, the benefits of breastfeeding while on opioid replacement therapy, including methadone and buprenorphine, outweigh the risk. Potential side effects on the breastfed infants, this may include lethargy, the infant may have respiratory difficulty, may have poor weight gain also. So initiating methadone postpartum or increasing the dose to more than 100 mg daily while breastfeeding will pose a risk of sedation and respiratory depression in breastfed infants, especially if the infant was not exposed to these drugs in utero. Okay, so opioid replacement therapy, when we are giving, we need to monitor the infant for what signs? Yes. And if opioids are taken while breastfeeding, symptoms of withdrawal can occur in the infant after abrupt discontinuation of breastfeeding. That would be less likely with the slower weaning. So we need to keep in mind when opioids are being given to the mother for any reason, the breastfeeding should not be stopped abruptly because the infant or the baby may have withdrawal symptoms. So it has to be slowly or gradually weaned off. Methadone exposure may be associated with motor delays during the first year of life. However, the research on this is also very limited, and the long-term effects of buprenorphine on infants is also unknown. Related to marijuana and cannabinoids, the evidence regarding the effects of these in the breast milk on infant development is limited and conflicting. Tetrahydrocannabinol is concentrated in breast milk, and breastfeeding infants have detectable levels of these drugs, and marijuana can impair the ability to care for the infant in the mother effectively and safely, and if marijuana use is continued, the mother should try to limit the amount and avoid direct inhalation by the infant also, because it can harm the infant. And some cannabinoid products, including those labeled as cannabidiol only, they contain some other contaminants also, like microbes, pesticides, heavy metals, and all these can be very harmful for the mother as well as for the infant. Related to diabetes, insulin, metformin, second generation sulfonylureas, they are not found in the breast milk and are preferred for when breastfeeding. Newer diabetes medications like glucagon-like peptide 1 receptor agonist and sodium glucose transporter 2 SGLT2 inhibitors have not been studied in lactation, and these agents are large peptide molecules. Therefore, the amount entering the breast milk, they are presuming that it may be low, and the GA absorption also may be unlikely in the infants. But the manufacturers of SGLT2, they do not recommend this drug during the breastfeeding because of the theoretical risk to the kidneys of the newborn babies. And medication labels, they recommend against the use of SGLT2 inhibitors and GLP-1 receptor agonists during the lactation. Okay, so mostly the older drugs like insulin, metformin, and second generation sulfonylureas, they are safer in diabetes if we want to use. For hypertension, most of the medications are generally acceptable to use during lactation. Calcium channel blockers, they poorly pass into the breast milk. Diuretics, they also do not affect the breast milk production and they do not pass into the milk. Angiotensin converting enzyme inhibitors also do not pass significantly into the breast milk. Angiotensin receptor blockers are highly protein bound and they are not expected to enter the breast milk. Further studies are needed related to this. Literature is less on it. Excretion of beta blockers into the breast milk can vary from drug to drug, and they are not typically first line treatment of hypertension, so usually may not be given to a lactating mother. Labetalol and metoprolol, they appear to be minimally excreted and they are well tolerated, but caution is advised when breastfeeding, when the mother is breastfeeding a preterm infant. For the upper respiratory symptoms, topical treatments are safest. Nasal steroids such as fluticasone or budesonide are safest, and most effective treatments for allergic rhinitis while breastfeeding, because topical administration, it minimizes the systemic absorption and the infant exposure. Nasal saline, antihistamines, cromolyn are safe, but they may be less effective. Topical decongestants such as oxymetazoline are preferred to systemic decongestants because they are less likely to affect the milk supply or less likely to be absorbed by the infant also. Then pseudoephedrine should be used only when there is well-established milk supply because it impairs the production of the milk. Second generation antihistamines like loratadine are less sedating and unlikely to harm the breastfed infant because of low absorption, but they may decrease the milk supply in the mother. First generation antihistamines are less favored because they cause greater reduction in the milk supply and may cause maternal as well as the infant sedation. In asthma, management of asthma is not significantly changed during breastfeeding. Absorption of inhaled steroids is unlikely to affect the breastfed infants. Despite limited study, inhaled bronchodilators are usually accepted during the breastfeeding in the breastfeeding mothers. During exacerbations, oral or IV steroids can be used. Amount of prednisone in the breast milk is very low and no adverse effects of prednisone also have been seen in the breastfed infants. If the mother is taking high doses of steroids or has prolonged steroid use, breastfeeding should be delayed for 4 hours after a dose to decrease the infant exposure, and high doses of any steroid can decrease milk supply or can delay lactation in the mothers. Moving on to the analgesics. Ibuprofen and acetaminophen are the preferred agents for pain control during lactation because of their safety when prescribed to infants and because of the low concentrations in the breast milk. Long-term use of naproxen is discouraged because it has a long half-life and there has been reports of bleeding, anemia and emesis in the breastfed infants. Etodolac, meloxicam, prioxicam and solindac are not recommended in the breastfeeding because of the limited data. Topical and local anesthetics may be used safely in breastfeeding. If an oral opioid is required for pain control, hydrocodone or morphine are the preferred drugs whenever possible. The recommended daily dose of hydrocodone is 30 mg or less because of its longer half-life. Hydromorphone should be avoided. Oxycodone also should be avoided because it has a CNS depressing effect on almost 20% of the infants whose mothers have been taking this. And mepridine also should be avoided during breastfeeding because of its long-acting metabolite that is more sedating in infants. Moving on to the antibiotics. Many commonly prescribed antibiotics are compatible with breastfeeding. There may be a risk of infant experiencing an allergic reaction to antibiotic or developing diarrhea because of the changes in the enteric flora. Hematochezia in infants exposed to IV clindamycin in breast milk have been reported, so they may have bloody stools. Infants may have bloody stools if the mother is getting IV clindamycin. Because of the risk of bilirubin displacement and kernicterus, trimethoprim, sulfamethoxazole should be avoided in jaundiced, ill, stressed or premature infants. And they should also be not used while breastfeeding during the first month of life or in infants who are having G6PD deficiency because it increases the risk of hemolysis in these babies. Cephalosporins are safer alternatives. Candida infection and diarrhea may be more common in infants who are exposed to metronidazole. Calcium in the breast milk decreases the oral absorption of fluoroquinolones and doxycycline. And antibiotics may also alter the taste of the breast milk and can cause the infant to decrease the intake. So when we are giving certain drugs to the lactating mother, some drugs may change the taste of the breast milk also, and that may affect the intake of feed or taking of the feeds by the baby. So that consideration also should be kept in mind. Moving on to certain herbal supplements. Herbal products, particularly galactogogues, as somebody said that some traditional cultural medications or herbs are being taken by the mothers to increase the milk production or for certain other reasons after the delivery. Cultural practices are there, so they may be used to increase the milk production. And common galactogogues, they include fenugreek, fennel and milk thistle. These all have limited evidence for effectiveness in increasing the milk production, but they have no risk of toxicity also. Because herbal products are not subject to the same standards of content verification, manufacturing purity, effectiveness as medications, reliable information on the safety of these products is usually lacking during the breastfeeding. Kava and yohim bine have been shown to be harmful to the infants who are exposed to breast milk. Sage, peppermint, parsley, chasteberry, jasmine, these are the herbs that appear to decrease the milk production. Moving on to the contraceptive agents, non-hormonal contraceptive methods such as barrier methods or puberty insertion, they may be preferred. And the estrogen in the oral contraceptives, it does not affect the composition of the breast milk or infant growth and development, but it may decrease the milk production. Progestin-only contraceptives, including levonorgestrel, releasing intrauterine system, and etonogestrel, subdermal contraceptive implants. These are the hormonal contraceptives of choice during the breastfeeding to avoid potential complications of thrombosis and decrease milk supply from the estrogen exposure. And some recommend avoiding hormonal contraceptives for 4 weeks or longer to allow the lactation to be well established. Then IV radiologic imaging agents. Sometimes breastfeeding mothers may have to go through some kind of radiological procedures or may be exposed to certain agents. So the amount of iodinated and gadolinium contrast excreted into the breast milk and absorbed by the infant's GI tract is expected to be small. Therefore, both agents are considered compatible with breastfeeding. Radiopharmaceuticals such as those used for thyroid or cardiac scanning are concerning for the breastfeeding infant, and they should be avoided by the lactating mother. Breastfeeding should be stopped for radioactive iodine 131 exposure because of the accumulation in the lactating breast, and it is risky for the infant also. Technetium preparations vary in safety during breastfeeding, and a radiologist should be consulted to assess the need for or length of breastfeeding cessation. So for some time till they are in the mother's body, the breastfeeding may be stopped temporarily. So these are some of the antibiotics which are safer for administration during lactation, like cephalosporins, penicillins and vancomycin, and fluoroquinones and macrolides, and some should be used with caution like clindamycin, which may cause diarrhea in the infant, doxycycline, metronidazole, which may cause diarrhea and candida infection, nitrofurantoin, which should be avoided in infants with G6PD deficiency, and trimethoprim and sulfamethoxazole, which should be avoided in newborn babies and babies with G6PD deficiency. So if I want to give you a gist of the medications and the conditions where which medications are preferred and which are acceptable and which should be used with caution and which should not be used in certain conditions, like in allergic rhinitis, Cromonil, nasal decongestants, nasal steroids and saline are the preferred drugs. Loratadine is acceptable, okay? And in analgesics, the preferred ones are acetaminophen, ibuprofen and topical diclofenac. And which should not be used at all are codeine, hydromorphone, mepridine, naproxen, tramadol, all these should be avoided. In anxiety, lorazepam is a preferred one, and clonazepam should be used with caution. In asthma, inhaled bronchodilators, steroids, montelukast, prednisolone, they are the preferred ones. And theophylline should be used with caution. For the ADHD, methylphenidate is the preferred drug. For the contraception, non-hormonal and progestin-only contraceptives are the preferred ones, and combined oral contraceptives should be used with caution. In depression, paroxetine and sertraline are the preferred ones. In diabetes, as I told, insulin, metformin, second generation, sulfonylureas are the preferred ones. And in hypertension, angiotensin converting enzyme inhibitors, angiotensin receptor blockers and diuretics are the preferred ones, and beta blockers should be used with caution. And certain drugs which are contraindicated in breastfeeding is drugs like amiodarone, because it has a long half-life, it has iodine containing molecules and may affect the thyroid function in the infant. Antineoplastics, because they can cause leukopenia and bone marrow suppression. Gorosols, which can cause rash, nephritis, hematological abnormalities. Iodine in high doses, because it can lead to the risk of infant hypothyroidism. Lithium should be given only when rigorous monitoring can be done of the lithium levels in the breast milk. Radiopharmaceuticals, we need to contact what kind of active drug is being administered, and retinoids, oral also, they are potential for serious adverse effects. Okay, so these are some of the, this is similar thing only, that some of the drugs which need to be avoided. I have already discussed these, and these are some of the evidences, and so I would just like to tell about certain general rules to consider if a medication is safe during lactation or not. So if a medication, as I told you, is commonly prescribed for the infant, it's likely to be safe to be taken by the nursing mother also. Medication is considered safe to take during pregnancy, are with few exceptions also safe to be taken during lactation period also. Only take a medicine if really required, and consider alternative non-drug therapies in the lactating mothers if possible, and try to give the lowest dose possible to the lactating mother whenever possible and for the shortest time period. Avoid extra strength formulas, avoid sustained release or extended release medications, and try to give medication only at one time, okay, rather than giving them in a 2 or 3 times in a day. And when possible, use single ingredient medication rather than giving a multiple formulas, okay. Like for example, if mother only has cough, use a single ingredient cough suppressant rather than cough suppressant combined with decongestant. So less is more better in the lactating mothers. Always read the medication label and package insert for any precautions or any warnings, and never hesitate to call a doctor or to consult your colleagues or to a pharmacist when you feel that this medication may be concerning for the lactating mother or for the newborn baby. Okay. So do infants' health and age determine how they may be affected by medication in breast milk? So age, does it determine how the baby will be affected by the breast milk of the mother who is taking medications? Yes, we have already discussed, right? So which babies will be more affected? Premature babies, then smaller babies, and babies who are sicker, who are not healthy, right? In them, it will be, the effect will be more, okay? And the influence, what influences the risk of adverse effects on the baby is the timing of the dose, okay? Like as I told you, that mother should feed the baby before taking her dose, rather than feed the baby after taking the dose, to reduce the amount of the drug in the breast milk. Then oral bioavailability, how much of that drug is going up to the gut and how much absorption is happening of that drug in the gut. Okay, some medications, they are enteric-coated medications, and when they go through the breast milk, they may not be absorbed in the gut. They may have their absorption at some other point, so they may not affect the babies in the similar manner as those which are absorbed in the gut. Then the toxicity, okay. Premature babies and neonates, they have lower capacity to metabolize and excrete the drugs, so in them the toxicity may be higher even with the lower doses of the drug being passed through the breast milk, okay. And then volume of the breast milk, how much the baby is taking, how much feed the baby is taking. As I told you, in the first 2 days, only when the baby is taking a small amount of colostrum, or less amount of drug may be transferred to the baby through the breast milk, right? And that is another thing which should be kept in mind, and the age of the infant should be kept in mind, as well as the product information. Though we may get the information on the websites and other things, and if we have a pamphlet or something along with the drug of a specific company, try to read it completely and try to take an information whether a lactating mother can take it or not, okay? So do the mother need to stop breastfeeding while taking the medications? Does the mother need to stop breastfeeding while taking the medications? In most of the cases, no, right? So we have discussed on case-to-case basis this thing, right? And we need to weigh the risk and benefits when prescribing the medications, and we need to consider the need for drug by the mother, the potential effects of the drug on milk production, the amount of drug which is excreted into the human milk, the extent of oral absorption by the breastfeeding infant, the possible adverse effects on the breastfeeding infant, and the age of the infant. Okay, then what about social drugs? What are social drugs? You are going in a social party or something, or mother may be taking 1 or 2 alcoholic drinks daily. So whether she should continue that or not? Okay, so advise the mother to delay a glass of alcohol until after a feed and wait for 2 hours before the next feed to minimize the infant exposure if she can't stop that. Okay. Nicotine replacement therapy is better rather than smoking or something, and passive smoking also can affect the infant, so a counseling of the mother needs to be done for that. Okay, and also high maternal intake of caffeine. It is also associated with irritability and poor sleep patterns in the infant, so caffeine intake, you need to counsel the mother related to that also. So to conclude with, most commonly used drugs are relatively safe for breastfed babies. The dose received via milk is generally small and much less than the known safe dose of drugs used in neonates and infants. Further, most lactating women take few medications and often only occasionally. For women on chronic medications, most can be reassured, but some drugs will be contraindicated and others not yet adequately studied. And good resources are available, including state-based drugs and medication information services, which should be utilized. Thank you.
Thank you so much, ma'am. Please, ma'am, please stay on the stage for felicitation. I would like to invite Mr. Rohit on stage to felicitate Mrs. Rupinder Deol, ma'am. Thank you so much, ma'am. We had a great session with you. Until now, we had a great session and got to know about a lot of things. Now it's time for lunch. I would like to request all the dignitaries, students, please join us for the lunch. Except here students, I would request all the students go to the lounge and all the dignitaries please move to the office.